Respected dignitaries, teachers and dear students, a warm welcome to today's session of our guest lecture series, Sadhana Sambhasha and Chikitsa Mantana. Today we are blessed with the presence of our esteemed guest, Dr. Veena G. Rao ma'am and Dr. Ganesh Rao sir. Let us invite our respected dignitaries to the stage. With great respect, I request Dr. Veena G. Rao ma'am and Dr. Ganesh Rao sir to kindly come forward to the stage. Now I request our respected principal, Dr. C.T. Basavarajappa sir to come on the stage. I request our Dean, Dr. Lakshmi Narayan sir to kindly come forward to the stage. Let us commence the ceremony with the lighting of the lamp, symbolizing knowledge, purity and enlightenment. I humbly invite the dignitaries to join us for the auspicious lamp lighting ceremony. Thank you everyone. Please be seated. Now I invite Dr. Madhuru Kalyani ma'am for welcoming and introducing our honorable guest.
A very good morning to everyone. It is an honor to welcome a distinguished scholar, an exceptional clinician and an inspiring teacher, Dr. Veena G. Rao ma'am. Dr. Veena ma'am serves as the professor and HOD of PG studies in Panchakarma at the renowned JSS Ayurveda Medical College, Mysore. With more than 2 decades of dedicated service to Ayurveda, she has shaped countless students and contributed immensely to the growth of Panchakarma education and clinical practice. She is a gold medalist in BAMS from Mangalore University, and ma'am completed her PG studies from Government Ayurveda Medical College, Mysore. And Dr. Veena ma'am stands high as an academician leader and a research par excellence. Her remarkable journey is adorned with prestigious accolades such as Vishwa Ayurveda Gaurava Samman, the Best Teacher Award, the ISSN Research Star Award, and the International Best Research Award. With over 80 research publications, and several ongoing funded research projects under RGHS and CCRS. Dr. Veena ma'am continues to contribute transformative insights in areas like neurological disorders, metabolic diseases, Panchakarma therapies, and integrative clinical care. She is also a highly sought after resource person, delivering expert lectures across the country on Vata Vyadhis, Marma Chikitsa, Panchakarma research strategies, lifestyle disorders, and more. With a deep classical wisdom, clinical excellence, and compassionate teaching style, Dr. Veena G. Rao ma'am is truly an inspiring to all of us. Now, ma'am will be enriching our knowledge on the topic of diagnosis and management of Vata Vyadhi. I request ma'am to hand over the stage for the continuation of the guest lecture.
रागादिरोगान् सततानुशक्तान् अशेषकायान् प्रसृतानशेषान् औत्सुक्यमोहारतिधानजगान योगपूर्ववैद्याय नमोस्तु तस्मै. My humble pranamas to the lotus feet of Lord Dhanvantari, respected principal of this Bapuji Ayurveda College. So we have studied, Dr. Basavaraj, we have studied together Kai Chikitsa PG in GAMC Mysore. And yes, I thank at the outset to giving me this opportunity to share my clinical experience in the treatment of Vata Vyadhi, so in this campus. See, nowadays the guest lectures are still prevailing. Why? Because there are so many online modules of learning like YouTube. Already classes are there in the YouTube, and there are online seminars, online conferences, and everything is online. But still this one-to-one is always a gold standard of learning. Still it is a gold standard. So everything matters, even the gesture, the level of confidence in learning and teaching methodology, everything matters to take up a motivation to make your life crazy towards the Ayurveda. So regarding, let us go directly to the topic, the Vata Vyadhi. Vata Vyadhi as such is a broad spectrum of diseases. Acharya Charaka, Sushruta, everyone considers the Vata Vyadhi, dedicated chapters to the Vata Vyadhi, but it is a broad spectrum of diseases wherein all neurological, ortho and rheumatology, everything is there in Vata Vyadhi. See, even Sandhigata Vata or the other varieties of the aches and pains all over, Vidrasi, Vishwachi, Avabahuka, everything is in Vata Vyadi. Pakshagata, Kampavata, like neurological disorders are also there in Vata Vyadi. Like all ortho, neuro, rheumato, everything is there in the Vata Vyadi. As such, in a short span of time, I cannot share the experience of the whole chapter. It is impossible. Anyway, I have taken up as requested by Dr. Veerabhadra. He is one of our students in JSS. So, as requested by him, I have taken up. So, he has told not to do classes, madam. You just take the case studies. So, whatever the experience you have, so we will deal with some neurological conditions, not with ortho and rheumato or part of Vata Vyadi. Okay? Is it okay? Yes. See, my favorite in Vata Vyadi is the word Prayena Pavanaha Prabhu. Vata is a leader. Vata is a leader. Prayena Pavana. Pavana is Vata, is a leader. Prabhu. He is a boss. Why? Because Vayurjataha Swayam Brahma, Vayurjataha Savai Harihi, Vayurjato Mahadevah Sarvam Vayumayam Jagat. So everything is Vata in this whole world. The Brahma, Vishnu, Maheshwara is Vata. And Vayurayur Bhalam Vayur, Vayurdhata Sharirinam, Vayuru Vishwamidam Jagat, Prabhur Vayushta Kirtitaha. Everything is Vata. See, the Swastha is explained with the importance of dosha, dhatu, mala, its anatomy and physiology should be proper with the integrity of the manas, atma and everything. But the Vata is the leader. Without Vata, all these becomes dumb. Pitta doesn't work without Vata. Dhatus doesn't work without Vata. Malakriya doesn't happen without Vata. My control of mind is impossible without Vata. Why? Because Vata is the leader. So we have a Vata Kalakaliya chapter wherein he says Vayu is Tantra Yantra Daraha. Vayu is Tantra Yantra Daraha. The whole body is controlled by the Vata. Vayu is Tantra Yantra Daraha. Is it not? Then he says Sarvendriyana Udyojakaha Sarva Sharira Dhatu Vyuhakaraha Sandhanakaraha Sharirasya Niyanta Pranayata cha Manasa. Manas is also controlled by the Vata. So we have to give much importance to the Vata compared to any other factors in the body. So, Pitta Pangu, Kapha Pangu, Ayurveda andre ide nenpagalu. Is it not? Pitta Pangu, Yatra Yatra Dhumaha Tatra Tatra one shloka, and the second one is Pitta Pangu, Kapha Pangu. See, this is a beauty of the science that everything is controlled by the Vata. So next, coming into the Vata Vyadi. What is Vata Vyadi? Vikrita Vata Janito Asadharana Rupo Vyadihi Vata Vyadi. Vikrita Vata. Vata in its normalcy is good for the body. So when it becomes abnormal, he has used Asadharana Rupa Vyadi. Asadharana means which is not common. See, if something happens to the brain, patient develops a stroke, Pakshagata, Asadharana Rupa. We cannot imagine the Adhisthana is brain and the sufferer is the half of the body. Asadharana, not Sadharana Rupa. Then Vayuhu, they say I am keeping it in a brief, like 1, 2, 3, 4, 5 lines. So Vayuhu, Dhatukshayat Popo Margasya Avaranencha. So you have studied from all first year to final years, you know what are the positive factors for Vata Vyadi. Ruksha, Shita, Lagu and all the Ratri Jagarana, Ativyayama, Ativyavaya, all factors you know. So directly these can aggravate Vata or Dhatukshaya. If any person suffers from chronic disease, say for example the AIDS or something like any other Pitta Vyadi, Kapha Vyadi, at the end there is Dhatukshaya because of the Vyadi and Vata can aggravate. And Margasya Avaranencha, the main function of the Vata is to move. It has to move from one place to another. So if its gati is blocked, there occurs the Vata Vyadi. You have Avarana of Vata and Marga Avarodha of Vata. So Vata is blocked at its gati or it gets Avarana. So all these can cause aggravation of the Vata, and that Vata, Vikrita Vata, produces Asadharana, not the common, uncommon the disorders in the neurological disorders in the body. Then now you take that vata has aggravated. What next? What next? So aggravated vata takes ashraya in any of the dhatu. It selects dhatu. Whether I should go and reach rasa dhatu to produce disease, whether I should go to and take ashraya in the asti dhatu to produce disease, majja dhatu to produce disease. See, if it takes ashraya in the asti dhatu, it produces the arthro disorders and rheumatological disorders. If it takes ashraya in the majja dhatu, it produces neurological disorders. Likewise, it takes ashraya in the mamsa and it can produce the disorders of the mamsa, like the myopathies, etc. So, it now decides where I should go and take ashraya to produce the disease. And what makes the decision? What makes the decision to take ashraya in the particular dhatu? So, it takes ashraya in the dhatu which is weak. See, always we can fight with a weak person than us. So, we always choose. We cannot choose the higher end to fight with the persons, is it not? So, we know that we will fail. So, it takes ashraya in the weaker dhatu. So, what makes the dhatu weak? The dhatu is made weak either by the hereditary factor or acquired factor. So, if a sports person, so he gets a fall and gets an injury into the knee joint, and that knee joint becomes weak. And later after 10 years, the aggravated vata takes ashraya in that knee joint and produces the osteoarthritis. That is acquired weakness of the dhatu. So you are very strong, habituated to take ice cream and ice cream. Your respiratory system becomes weak. So vata takes ashraya. So what that is? Acquired weakness. Hereditary means his father has suffered from some kampavata, neurological, that is the Parkinson's disease, or your tata has got the kampavata. That hereditary factor, genetic, makes the dhatu weak. So this aggravated vata takes ashraya in one or the other dhatu to produce the disease. So that vata will decide. So what particular the dhatu will be selected is the dehe srotansi riktani purayitva anilobali karoti vividhanvyadin sarvanga ekanga samstan. It knows, so which dhatu is weak, which dhatu is rikta. Rikta means empty. So it has lost its properties and become empty. So such dhatu it takes ashraya and starts producing the disease. So once this dosha sammurchana takes place, the first development of the clinical features is called as Purva Rupa. Purva Rupa, you know, right? So Purva Rupa, that is the prodromal features. Mild features can be seen as Purva Rupa, or this vata is unpredictable because of its chala property. Suddenly it produces diseases without any prodromal features also it is possible, and sometimes it may produce some Purva Rupa. Say for example, a patient may develop sudden loss of consciousness or sudden loss of muscle power in half of the body, and within some 10 to 15 minutes or within some 10 minutes the muscle power is regained. You call it as TIA, transient ischemic attacks. So once this happens, then now he is considered to be a prone patient for developing a established stroke. So Purva Rupa, it is giving a hint that this person's vessels are getting blocked and any time he may develop the stroke. So likewise, the avyakta lakshanam tesham pura avyakta, not complete full blown clinical features are not seen. Next, hetu sthana visheshatta bhavet roga visheshakrit, means so hetu, what has caused aggravation of the vata, that aggravated vata where it has taken ashraya, hetu and sthana, vishesha. So depending upon the specificity, then bhavet roga visheshakrit, different diseases are developing in the body. So vata vyadis though are numbered as 80 as nanatmaja vata vyadi, na anatmaja means na anatmaja means 2 negative is 1 positive atmaja. So without vata that disease is impossible. That is called as nanatmaja vata vyadi. So though we have vataja jwara, vataja pandu. So vataja is there, but that pandu can develop without vata also. Pittaja vyadi, that is pittaja vyadi. So you cannot call, though there is involvement of vata in every disease, but every disease is not vata vyadi. Followed? So without vata is that Gridrasi is not possible without vata. Then you call it as Nanatvaja. Though they are numbered as 80, but as such, Vata Vyadis are innumerable. See, now just a brief regarding what are all the possible Vata Vyadis. The Pakshagata, Kanja, Pangu, Sarvangaroga. So they all fall under the loss of muscle power. That is the hemiplegia, that is stroke or hemiplegia. Then paraplegia, that is a Pangu, where both lower limbs are lost. Lost in the sense, the ability to function of both the lower limbs are lost. Then quadriplegia, all four limbs are paralyzed. And all these paralysis falls under the group of this Pakshagata, Kanja, Pangu and Sarvangaroga. Ardhita, that is a facial palsy, you may be knowing. Like Kampavata, Tandavavata, they are all degenerative disorders. Kampavata, where the tremors, involuntary movements, dyskinesia, hemibalismus, etc. That is, the patient doesn't have a control over his involuntary movements. So, movement disorders, they are named as movement disorders. Majjagatavata, Avaranavata Vyadis are neurodegenerative disorders. Neurodegenerative disorders like the MND or the multiple sclerosis, etc. Then the ataxia, etc. Then Padidaha, Padaharsha, they are all neuropathy, sensory neuropathy. Patient says, I have got numbness, tingling sensation. Okay, so they are all called as the sensory neuropathies. Then the Madha, Murcha and Sannyasa, patient because of Vata Vyadhi falling unconscious. So you call it as Madha, Murcha and Sannyasa. So Chetana, that is the Samjnamaha Shrotas are affected in the Madha, Murcha and Sannyasa. Dasha Pranayatanam Hatva, 10 Pranayatanas are there. Trimarma, Dve Shankha, Kantha. Okay, so likewise the Mamsa, Shukra, likewise the Pranayatana are affected. So in this three marma, one is the brain, the shiras is a marma. When Vata afflicts that marma, the patient may fall unconscious. See, all these delirium, altered consciousness, coma, and all these fall under even the Vata Vyadis. And these are neurological Vata Vyadis. Now coming into rheumatological or the ortho Vata Vyadis, because the Manya Stamba, Vishwachi, like they suffer from cervical disorders, the bone, so degenerative, the prolapses, something like, then the patient may present with brachial neuralgia, the spondylosis or IVDPs. The Avabahuka, the frozen shoulder syndrome also fall under Vata Vyadhi. They are not neurological, they are joint disorders connected to the joint. And Gridrasi, the sciatica, you may be knowing, lumbar spondylosis, IVDP, etc. Then Sandhigata Vata like osteoarthritis, Vata Kantaka, plantar fasciitis or spur, etc. See, all these also explained under Vata Vyadhi, but they are ortho and rheumatological. And we have one more chapter known as Vata Rakta. They everything about the rheumatology, that is polyarthralgia. So that chapter is also there. So here we will omit the second portion of the Vata Vyadhi. We will discuss some first portion of Vata Vyadhi with some case studies. Then Vata Vyadhi Lakshanas. So in commonly if a patient complains of these clinical features, you should infer that the patient is suffering from the Vata Vyadhi. See, Sramsa Vyadhi, very common reference of Vata Prakopaka Lakshana. Sramsa Vyasa Vedaswapa Sadarukto, the Vedanam, I think you might have byhearted. Sramsa is a prolapse. So if there is a prolapse in the disc, cervical disc prolapse, lumbar disc prolapse, anything that prolapsed can produce compression, and compressive neuropathies can be possible. Vyasa, Vyadha, then the Sada refers to the weakness or paralysis. Then the Ruk, Toda, Vyadha, Sanghanga, Bhanga, they are all like aches and pains. Any pain, na Vata, Vina, Shula. No Shula is possible without Vata. So anything and everything Shula is Vata. So varieties of the Shula he explains. Then the rigidity and spasticity, like the Sankocha. Sankocha means spastic. The limb cannot be opened, it becomes spastic, rigid. So that is Sankocha. Varta means the twist and sprain. If a person walks and if he gets sprain of the ankle or twisted, so knee joint, injured joint gets instability, they are all known as Varta. Varta Harshana Tarshanam. Harsha Tarsha means numb and tingling sensation. Kampa, that is the tremors, dyskinesia, involuntary movements in Vata. Parushya Saushirya, the dryness and Saushirya means porous. Osteoporosis is also Vata Vyadi. Then Shosha is atrophy. Any patient suffering from lower motor neuron paralysis, muscular atrophy, the muscles becomes thinned out. So that is also Shosha. Spandana means fasciculation. Before the MND develops, there is quivering movements of the muscles. You call it as fasciculation. So fasciculation is also Spandana. Veshtana means a tightness. Stambha, stiffness. Then these are all the clinical features of the Vata Vyadi. Then he says Kashaya Rasata, the tongue will have the pungent taste, and Varanaha, Shava and Aruna Varana changes will also be Vata Vyadi. Now brief about nervous system examination. So first years should not feel bad that the treatment we cannot understand and we are simply sitting here. They should not feel bad. That is why I have kept 2 slides for the first and second years and even for Roga Nidana learners. So first, in our nervous system, any patient coming with the neurological disorders, you have to assess the patient. So first for the higher mental functions, like whether the patient is conscious. Okay, then you have to ask questions, what is your name, who is he, the attender and all. So we should know whether he is conscious and whether with altered sensations, or whether he is oriented to space and time. We may not be knowing that he is in hospital, whether the nearby attender is his own. There can be what you call it as orientation to space and time may be lost. So higher mental functions, the smriti, etc., you have to ask the history, how he has developed that disease. So if he cannot, then you can say the higher mental functions are altered. So next comes cranial nerve examination, a very brief, like olfactory nerve, you have to check for the smell with non-irritant, the smell like a mild soap or like. Then optic nerve, visual acuity with Snell's chart, field of vision, color vision, you have to check. Then oculomotor, cochlear and abducent. So these 3 nerves, that is 3rd, 4th and 6th, you have to check for the eye movements, whether the patient has got squint, strabismus, nystagmus, the jerky movements of the eyeballs. Then pupillary reaction to the light, consensual reflex. If you put one eye, the light other pupil should contract. So pupillary reactions you have to check. Then trigeminal, the 5th nerve, the sensation you have to check for its trigeminal, 3 innervations. Over the face you have to check with the cotton ball whether the touch the patient can appreciate, or a pinprick over the face patient can appreciate or not. Blink response, you have to put just one cotton ball to the eye, then whether the patient will blink it or not. So that is the clench the teeth, you have to ask the patient to clench the teeth and jaw jerk should be tested. Then comes the 7th facial nerve, a very common disorder, that is facial palsy, you call Bell's palsy. So you have to check for the asymmetry of the face, or any involuntary movements. Sometimes the homofacial spasms will be seen, or in some patients orofacial grimacing movements are also seen. Then raise the eyebrows, the frowning of the forehead you have to check. Then eye closure, ask the patient to close the eyes. In Bell's palsy, the complete closure is not possible on the affected side. Purse the lips, so you have to ask the patient to purse the lips like this, whether patient can do it. Then the puffing the cheeks, you have to puff out the cheeks, ask the patient to fill air into the cheeks, whether the affected part will be more puffed out, and the taste, anterior 2/3 of the tongue taste is appreciated by the facial nerve innervations. Then vestibulocochlear, the 8th one, you have to check for the assessment of hearing, whether air conduction, bone conduction, I think all will be taught there. Then you have to check for the vertigo assessment, Romberg sign and all. Then glossopharyngeal, the last 2/3 of the tongue and the pharyngeal reflex. So you have to check with a small stick attached with a cotton ball, touch, and then whether it contracts or not, you have to check. Then the vagus nerve, the nasal regurgitation, nasal dysarthria, the patient cannot utter the word which can be possible with the palate, like you say egg, the patient says so they cannot utter. So nasal the dysarthria, skeletal elevation, breathy noise, bovine cough, stridor and all. And accessory nerves, shrugging the shoulders. Ask the patient to shrug the shoulders, whether they do it or not. That is a function of accessory. And hypoglossal nerve, that is the wasting of the tongue. Tongue gets thinned out and there can be tremors of the tongue known as fasciculation or tremor of the tongue can be possible. This is very, very brief so that one should not sleep. First years are okay? Yes? Next is the motor examination and sensory examination. There are only 3 parts of examination in a nervous system. One is higher mental functions, that is the first brief, and the second one is cranial, the third one is motor, and the fourth one is sensory. So motor examination, even if you are awakened at night, you tell me the 10 points of motor examination, you should be able to say. So the first one is tropical changes. Any patient comes with neurological disorders, bedridden, you have to check whether he has got bed sores or not. That is tropical changes. Next comes atrophy and hypertrophy. Any muscles are thinned out or not. Or sometimes some muscles are thinned out and some muscles are increased in the bulk. You call it as dystrophy. Is it not? See, in lipid profile, if some are decreased, hypo, and some are increased, hyper, and some decreased, some increased, what you call dyslipidemia, dystrophy, dyslipidemia. So likewise, the muscle bulk you have to check. Muscle bulk is normal in upper motor neuron, whereas it gets thinned out in lower motor neuron. Then fasciculation and irritability. So you have to check, you have to give a tap over the muscle bulk and see there is quivering movements or not. So it is again a Purva part of the MND, prodromal features for motor neuron disease. Then contraction and contractures. If a patient is brought after 1 year of stroke and the patient will have a contraction, they will keep the limb like this. Even if you are pushed to open it, the patient cannot. You say, if you can, third person can push and open it, it is a contraction. It is a reversible contraction. So even if you put pressure also, it cannot be opened, then it is a contracture, which is irreversible. So both are stamba, rigid cogwheel rigidity, lead pipe rigidity. There are varieties. So that is contraction and contracture. Involuntary movements, the patient may present with tremors in a sitting posture. The patient may have the minute tremors. You call it as a patient comes with a Parkinson. Just by the gait and looking in the hand, you can say he is suffering from Parkinson. So mild tremors of the hands will be there. Then there are some dancing movements. Patient cannot control the movements like this. You call it as dyskinesia. Dyskinesia, involuntary movements. So that all falls under examination. Muscle power, you should check under resistance. So if you want to check the extensor muscle powers, give a pressure from outside and ask the patient to open. If you want to check the flexor muscle power, give resistance like this and ask the patient to flex. You followed. So some patients are coming, so their patient party will be there. They say, I don't have strength in the lower limb at all. So it is the doctor's duty. Why the patient says, I have no power, I cannot walk. So if a patient cannot walk for 3 reasons. One is because of the pain, severe pain, patient cannot get up and walk. The second is the muscle power is lost, paralyzed, cannot walk. The third is hysteric. Everything is okay, only in front of the patient and patient family they cannot walk. And after that they can dance also. See, there can possibilities only 3. Now it is our duty to check whether the patient is really paralyzed or not. So 3 reasons, pain, paralysis and hysteria. So you have to check. So for that we need to have the muscle power check, whether the patient's muscle power is lost or not. So you can grade also 1, 2, 3, 4, 5. Next, reflexes, the deep tendon and superficial reflexes you have to check, and clonus over the leg. Then coordination you have to check, that is the heel to knee test, heel knee test and finger to nose test, coordination. Cerebellum, if it is involved in the pathology, this coordination will be lost, patient will be ataxic. Then the posture and gait, you have to ask the patient to walk and you look into the posture of the patient. So looking into the posture, a long distance only you can say whether it is a Parkinson disease, scissors gait with the CP, and a high steppage gait with neuropathies, all gait and just, so you have a textbook only on posture and gait in neurology. So like looking into the patient, how he sits, how he stands and how he walks, you can diagnose what is a condition and to which part of the brain it is involved. So you have two diagnoses, one is pathological diagnosis, the second one is anatomical diagnosis in neurological disorders. You have to check if a person cannot walk, you have to see whether it is because of the disorders of the brain, disorders of the spine, which part of the brain and spine, that is you call it as anatomical diagnosis. Otherwise it is a pathological diagnosis. Then sensory nerves, tactile sensation. So you have to brief touch, whether a single touch, whether the patient can appreciate or not. Deep sensation with a blunt and the sharp objects. Then temperature sense, you bring two test tubes, hot water, cold water, check whether patient can appreciate or not. 2-point discrimination, you have to prick with 2 points, whether patient says that prick is single or two different. 2-point discrimination. Then the vibration sense, you have to have a tuning fork and touch whether that vibration patient can appreciate or not. Then stereognosis. Stereognosis means the regular items you have to give it to his hand, ask the patient to close the eyes, give a phone, mobile, and ask the patient to say what is this. If the patient says phone, then stereognosis or a key bunch, something like the patient should be able to appreciate. So these all fall under sensory examination. So we have in the examination nervous system, higher mental functions, cranial nerves, motor nerves, sensory nerves. So these are the part of examination of the. Then now coming into the Pancha Vayu. Vayu, 5 types of Vayu are affected in the neurological disorders. So with what clinical feature you say this type of Vayu is involved? See, for all motor functions, all motor, the flexion, extension, ability to walk, sit, dance, everything is due to Vyanavata. The movement of the blood in the body, the ability to see from the indriyas, and everything is due to the closure of the eyes, opening of the eyes. Every function is due to the Vyanavata. And a patient of if you imagine that a patient has got a road accident and hit to the brain, hit to the skull, and patient is unconscious. So the patient is taken to the hospital, immediately he is put in a ventilator, the respiratory support is given. So if all such are there, then you say that respiratory distress is there, then a ventilation is given or tracheostomy is done to have a artificial respiration. You say the vata which is involved is prana and udana, wherein brain stem is involved in the pathology. The medulla, pons if it is involved, then respiratory center is there in the medulla, so this will be involved. Then cardiac issues, then again brain stem, the medulla is involved, patient will have cardiac issues because that center is also there in the brain stem, so patient suffers for the cardiac support. And swallowing difficulty, you may be knowing any stroke patient or any respiratory distress with RTA etc., they will be on Rayleigh tube, feeding tube. They cannot swallow, they cannot deglute. So a Rayleigh tube is put, then swallowing is action is by the prana and udana. Is it not? Urahasthana mudhanasya nasana abhigalamshtare, vak pravritti, speech, prayatnorja, balavarana smritikriya, all. See, all these functions, if distorted, then will result in. So, any neurological emergency case presenting with respiratory distress, cardiac issues, swallowing difficulty in ICU, say prana, udana are involved. Vyana invariably in all. Vyanavata is invariably involved in all the functions, for all the functions. That prana and udana are involved if the patient of the neurological disorder is in ICU. Prana and udana are involved. So next comes the sensory organ functions, indriyanam. So if the patient cannot see, cannot hear, cannot speak, cannot taste, so all these indriya functions, sensory, then the prana is involved for all cerebral cortex, then visual cortex, auditory cortex, gustatory. So all these, olfactory is a smell, if lost, then this is a pranavata. Then speech defects, prana and udana is involved. Broca's area, So that is for frontal lobe. The patient cannot understand the language, is Wernicke's area, so they are also involved in prana and udana. Then intelligence, memory, mental dysfunction, intelligence, memory is lost, then you say the prana and udana are involved with the involvement of the cerebral cortex. Then gut issues with the patient, then samana is involved. If there is autonomous nervous system is involved with loss of bowel and bladder dysfunction, you say apanavata is involved. Followed panchavayu, how they are involved in the neurological disorders. So now coming into the chikitsa part. So if you have any questions, you can write down and you can ask at the end. So I will try to answer your questions, right? Now coming into the chikitsa part, general principles of treatment, that is to any disease, the first involvement of the dosha, dhatu, first in acute case, the patient will present with ama. Ama is a must in every disease, so you have to start with the treatment of Deepana and Pachana. Next comes Vata Vyadhi Chikitsa, Vatasyopakramaha, Snehasvedaha Samshodhanam Mrudu. Samshodhanam Mrudu. Mrudu Shodhana is essential. If Shodhana is drastic, then again Vata will going to aggravate. Ati Yoga will aggravate the Vata. So Mrudu Shodhana, you should make sure that the Shodhana given to the patient is Mrudu. And Anulomana. Sa Ama Vata Chikitsa. Ama Vata should be treated. Every Vata, to start with, Vata Vyadhi will present with invariably with the Ama. So Ama should be treated. Next comes Gata Vata Avarana. If there is any Samsarga, Avarana, Gata, one place to another place it has gone, and then you have to treat that Chikitsa. And next comes last, the Kevala Vata Chikitsa. Now comes the treatment for the Vata. I told Vata is a boss. You cannot go and treat Vata at first. Vata should be treated at the end in Vata Vyadhi. ಯಾವುದೋ ಒಂದು ದೇವಸ್ಥಾನದಲ್ಲಿ ದೇವ್ರು ನೋಡ್ಬೇಕಂದ್ರೆ, ಯಾವುದೋ ಒಂದು ಆಫೀಸಲ್ಲಿ ಬಾಸಲ್ಲಿ ನೋಡ್ಬೇಕಂದ್ರೆ, ಆ ಬಾಗ್ಲಲ್ಲಿ ಕೂತವ್ರಿಗೆಲ್ಲ ಹೇಳ್ಬೇಕು ನಾವು ಯಾಕೆ ಬಂದಿದ್ದೇವೆ, ಏನು ಎತ್ತ, ಚೀಟಿ ಕೊಡಿ. ಅವ್ರೇನಾದ್ರು ಹೋಗ್ಲಿಕ್ಕೆ ಬಿಟ್ಟರೆ ಮಾತ್ರ ಹೋಗ್ಲಿಕ್ಕೆ ಆಗೋದು. If they obstacle us from entering into, then you cannot. So you have to fight with those. So first comes Ama. He says, treat me first. If you can able to, pass me, then only you can go to the boss Vata. So if you are not able to treat Ama, you cannot reach Vata. Next comes Pitta. Pitta tells, so now you fight with me. If you are okay, then I will allow you to go to Vata. Then comes Kapha. So Avarana. So everything if you can pass, then you can go and treat the Vata. Vata, if you start treating Vata at first, then totally the treatment is utter failure. So any Pakshagata patient comes, you do Abhyanga, total failure. Third day patient cannot get up at all. I tell you why? Because Vata needs Snehana Svedana invariably, but not at the first. You have to see, you have to check, and you have to pass the three stages, the Ama, Pitta, Kapha, everything. If it gives yes, you can go further. Then only you can go to Vata and treat the Vata. So next comes Kevala Vata Chikitsa. So once the treatment is done and the patient is okay, then you have to treat. You have to see that disease doesn't recur in the patient. So there comes the role of Brahmana and Rasayana. So again the Panchakarma therapy, Snehana, Svedana, Vamana, Virechana, Basti, Nasya, Raktamokshana, Bahya Krama according to the disease condition. Then Shamana, in Shamana, Atyek, emergency treatment, Lakshanika, the patient should have a symptomatic relief, and Dosha Vyadhihara Chikitsa should be done. Then you can have an integration with physiotherapy, speech and hearing, nursing care, and Sattva Vajaya with yoga and dhyana. So now let us take up one disease. Are you okay? Bored? Motivated? Yes. So if you have any questions, you can stand up in the middle and can also ask, because otherwise those who are sleeping can also get up. Oh, my friend is asking question. We had a teacher, Dr. Muralidhar Sharma in Shalya in SDM Udupi. Then when he is doing class, if anybody sleeps, then he doesn't call that person who is sleeping. He will call the next fellow who is sitting beside and ask the patient to wake up. Why? Because he says, Malkondavanannu yaru ebbisbardanu. is a papa. So he will call that person who is beside and ask the person to get up. So I cannot call and wake you up. So I will ask some other, the nearby, to ask one question so that madam nodtare hedu and is it not? So now we will go to one condition, that is Pakshagata. A very brief about the Pakshagata. That is, Pakshagata is also named as Ekanga Roga. Ekanga Roga. Hatvaikam Marutam Paksham Dakshinam Vamamevava Kuryat Cheshta Nivurtim Rujam Vakstambhamevacha. A patient who is having loss of activity on one half of the body, that is right half, that is upper limb and lower limb, if functions are lost, you call it as Pakshagata. That is, it depends upon the site of the region, whether the patient is suffering from any disease. You have to see why that person is paralyzed. Why that person is paralyzed. Whether the pathology is in the brain and the spine, you have to check. If in the Pakshagata, it conditions in the cerebral cortex, if it is there, internal capsule, if the brain hemorrhage or the infarction is there in the internal capsule, what? And brain stem, what? Brain stem, there are origins, so many cranial nerves. If third and fourth cranial nerve palsy with Pakshagata, fifth and sixth cranial nerve palsy with Pakshagata, everything depends upon the site. And the second one is the CT and MRI will confirm whether what is the cause, whether it is an infarction, the blockage of the blood vessels, or the hemorrhage. If the person is bleeding, the hypertensive hemorrhage, aneurysm with hemorrhage, RTA, road accident with hemorrhage, brain hemorrhage. So that will lead to the stroke. Or if the person is suffering from neoplasms or the tumors, so patient can also present with so there are still more causes. These are the very three common causes for the paralysis. Paralysis, colloquially it means Pakshagata. The word paralysis refers to loss of muscle power. Complete loss is paralysis and the partial loss is paresis. These are the two terms. Paresis is the still muscle power you grade out. 5 muscle power is 5. For we and you, the muscle power is 5. If one muscle power is lost, if it is 4 bar 5, 3 bar 5, 2 bar 5, you are giving marks for out of 5 how much. So if 1 bar 5 means, so totally he is bedridden, he cannot have any movement. So then the examination, as I have told, you have to check, and then comes, you have to say whether it is a UMN or LMN pulse. So what is UMN? Very, very briefly, so that you cannot forget. Then UMN is the pyramidal tracts. From the cerebrospinal tracts, from the cortex of the brain, it descends into the spine, crossing at the medulla. You call it as medullary decussation. So crossing at the medulla, that is the UMN. So from cerebral cortex till lumbar 1 and 2, this tract descends. Follow? So what is the LMN? LMN is the nerves which emerges from the spinal cord. So cervical level it emerges and it innervates over the upper limb. Thoracic level D, dorsal vertebra, right? Dorsal vertebra, thoracic vertebra, the spinal nerves, motor nerves emerges and it gives innervations to the chest and abdomen, upper. Okay, so lumbosacral region, it descends into the lower limbs and gives muscle power. So what nerves, motor nerves which emerges from the spinal cord are called as LMN. The nerves which emerges from the brain to the spinal cord are called as UMN. UMN is spastic, rigid. LMN is flaccid. So no muscle rigidity is not there. Muscle rigidity. So here you have to check. So if you check whether the muscles are rigid, very rigid, rigidity is a classical feature of UMN. Rigidity is a classical feature of UMN, and if the limbs are rigid on reflexes, there will be exaggerated reflex. So if you see the biceps, triceps and all, you have studied, right? So in the patients, so if it is exaggerated and muscles are rigid, you say it is UMN. If the muscles are flaccid, and reflexes are lost, you call it as areflexia, then it is the LMN. Very simply, within 1 minute you can so one more technology. So there are so many researches are going on clubbing the Ayurvedic science with the technology. Is it not? Yes. So first case we will discuss is a patient of post-surgical case of the aneurysm cerebral hemorrhage. The patient had the cerebral hemorrhage because of 45 years female with a CT angiography saying ruptured right DACA aneurysm and unruptured right MCA aneurysm. So there is aneurysm. What is aneurysm? Aneurysm means it's a pouch-like projections in the blood vessels. So because of the pressure, there will be pouch-like bulging over the vessels. So sometime because of hypertension, these appear and suddenly it may break open causing hemorrhage in the brain. Or RTA, road accidents can cause hemorrhage. So any hemorrhage. So this lady, 45 years female, she developed brain aneurysm, ruptured resulting in hemorrhage and stroke. So here the patient, this is from the Nimans, the patient got operated from the hemorrhage and bifrontal craniotomy was done and the skull, the flap of skull was fixed to the abdominal wall. Her skull was removed, half craniotomy was done and that was fixed to the anterior abdominal wall over the right abdominal fascia. So patient had directly after the surgery, after 3 days, the patient was shifted to our hospital. So when I checked the left-sided upper and lower limb weakness, the muscle power was 0/5, 0. So no muscle power at all. Out of 5, the marks is 0 for the muscle power. Totally bedridden patient. Okay. So here our Acharya says, Krishno ardhakayastasya takarmanyo vichetanaha ekangarogam vitam vidyat anye pakshavadam viduhu. This is called as pakshagata. So ardhakayastasya, either right or left is paralyzed. Akarmanyo, he cannot do any work. Akarmanya, vichetanaha. Vichetana means there is the loss of consciousness, or in another terms the sensation may also be lost. There are commentaries, 2 commentaries. So now the Scandinavian stroke scale. See, this is for the, we have to say that the modern neurologist, that what we have done is, we have to, give their explanation that these scores have improved, so the Ayurveda has worked. See, this is how you have to check for the Scandinavian stroke scale with all the consciousness, orientation, verbal communication, eyeball movement, etc. So the total score was 58 and the total maximum score is 58 in that stroke scale, whereas the patient has come at 16 and has improved after 7 days to 39 and after 14 days 47 and after the 21 days 3 weeks it has improved to 53. So I can show you the video. So this is what the patient was to start with. Next, after 15 days, the patient started walking with the support, totally unconscious. At that time, one of our sister in the hospital told, Veena madam yavaglu intadde admit madudu anta she was telling with the other staffs. Then she told later, when the patient improved, then only she told, I was telling you like that. So you can see after 3 weeks, the patient could able to walk with very, very minimum support. And so she got discharged, and on 45th day, the patient came for follow-up in the OPD. See, without support, she is walking after 1.5 months. See, this was a case, and after 1.5 months, she went to Nimans and she got that flap of skull and fitted over the crania, and again she came another one sitting of treatment so she will be all right throughout. So now let us discuss. So what is the treatment we have given? So started with Sarvanga Shitala Lepa. Shitala Lepa means, so when a patient has come, her consciousness was totally not full, she was not totally conscious. She was stuporous. Even if 10 times if you ask the patient's name, then only she used to open her eyes once like this. So she was stuporous, always drowsy, sleeping and all. So first the motto was to make her alert so that she can take our treatment and the mobile. So what is murcha? What is murcha? What is murcha? How do you define murcha? Murcha, see, dosha is murcha pitta tamaprayah rajaha pitta anilat brahmaha tamo vata kapastandra nidra sleshma tamo bhavan. See, murcha pitta tamaha praya, tamas, sattva, raja, tamas. So tamas with the pitta, murcha pitta tamaha prayah. So when a person is unconscious, then pitta is the major which is involved with the tamas. So first, don't give abhyanga because it is a stroke. I told you, no, don't go for abhyanga for the reason that it is pakshagata. First is patient is under murcha. Murcha is a pitta. Now we have to fight with the murcha, and if pitta gives okay, then we can go to next level treatment. So started with the Sarvanga Shitala Lepa. Started with the Esti Madhutaila, Shadadauta Lepa all over the body for 3 days, 4 days. Okay, 3-4 days Shitala Lepa was given, and then the patient immediately started opening the eyes, responding to the patient family members and all. Once the patient becomes alert, then the role of pitta is over. Now you are not supposed to continue with Shitala Lepa. Next comes the role of kapha and ama. Okay, so now I would like to say one here. The ama, how to treat ama? Ama is done nite niramatam same jidalangana pachanehi ruksha alepa sekaddehi kuryat kevala vatanut. That is ruksha alepa, ruksha seka, no oil, dry. Ruksha alepa, ruksha seka. Okay, so with deepana, pachana, langana, that makes amahara and kafahara. So next is ruksha seka. Ruksha seka, we have started next with the dhanyamla seka. Dhanyamla, you may be knowing, with the fermented, the liquid. So is it not? So with it, dhanyamla sarvanga seka was done. Then kapha, ama role is over. So after some 10, 12, 15 days, the patient could able to sit, able to stand in a physiotherapy setup. So next comes ama over, next comes vata, pitta over, with then kapha, ama over. Next, if ama gives certify us, then we will go to treat the vata. So vata can be done, treatment can be done with sarvanga abhyanga, sarvanga thaila seka, what you call physical, sarvanga thaila seka, or shashtika shalipinda sweda. So these treatments were performed, and then the patient could able to walk. And once the patient gone back and fitted with the skull, then after that her wound was very clear. Then in the second sitting we have done Shirodhara with Kshirabala Taila. And in second sitting we have done the Esti Madhu Taila Kshira Basti. See, always Esti Madhu is a choice for hemorrhage. Esti Madhu Kshira Kashaya is prepared and Basti was given. And later in the second sitting Mustadi Apana Basti was also administered. So here one thing I would like to say about the Erenda Taila Prayoga, the second one. I will tell the beauty of Erenda Taila later in next case. Okay, so the patient was administered with Rasarajarasa, because it is an emergency case. Rasaushadhi plays a major role here. Rasarajarasa and Jayamangalarasa. Jayamangalarasa is a rasa which is advised for all the varieties of the Jwara. Jwara is what? Jwara is ama, acute condition. So patient was administered with Jayamangalarasa and Rasarajarasa. See, Tapyadi Loha, which contains Swarnamakshika Bhasma, is a Stambhana. Wherever you want the Stambhana action to be done, go for the Swarnamakshika Bhasma. So, the Tapyadi Loha is the best for the, for the hemorrhage, and Drakshadi, Vidaryadi, Mridvikadi, these are all for Pittahara, and Mashatmaguptadi Kashaya is a Pakshaghatahara. The only Palashruti for Mashatmaguptadi Kashaya is Pakshagata. So if you take Rasnadi Kashaya, Maharasnadi Kashaya, Sahajaradi Kashaya, that Kashaya, this Kashaya, it has some 7, 8, 9, 10, 12 Palashruti can be given in so many diseases. But this Mashatmaguptadi Kashaya has Palashruti for only Pakshagata. Mashatmagupta Yerenda Vakyalaka Shrutam Pibet Ingu Saindava Sanyuktam Pakshagate Nivaranam. Only Palashruti. So very readily it can be prepared in the ward and can be administered to the patient. Even after discharge also ask the patient to prepare at home only 4 drugs. Masha andre Uddu, Atmagupta, it is Kapikachu, Yerenda Mula, Balamula, readily available raw drugs. We prepare the Kashaya, add Hingu and Saindava 1 pinch and ask the patient to take. So this is the best for the Pakshagata. So next we take up the second disease, second patient. It's a patient of RTA, road accident, head injury. So patient presented with quadriparesis. Quadriparesis means all the 4 limbs are paralyzed, not completely, quadriparesis. So some 3 or 4 bar, 3 bar 5, the muscle power was 3 bar 5 in all the 4 limbs. So he was a 73-year-old male patient diagnosed with RTA with head injury, with right frontal lobe contusion and left internal capsule, the hemorrhage and diffuse axonal injury to start with. So patient had been to Apollo Hospital in Mysore and later got discharged, saying that you take the patient home. And as the patient was one of our therapist, relative of one of our Panchakarma therapist, then he brought the patient to our hospital and we have admitted and treated the case. So he was unconscious and was on life support in ICU in our Apollo hospital there, has undergone tracheostomy for respiratory support with a peg insertion for the food. So not on the range tube, he was directly a peg insertion into the stomach, so through which the food was given. And later patient was observed for 20 days and was discharged. See the beauty of our science. He says, what is Shiro Abhigata? External injury to the Shiro Marma. Say here, Shirasi Abhihate, if a patient's Shiras head is injured, what happens? Manyastambam, Arditaha, Chakshu Vibramaha, Moha. Moha is what? Moha is Murcha. Moha, Murcha Mityahu. There are 2 meanings for Moha. The one is Murcha and another one is Tattvajnane, Mudata. Having no knowledge is also Muda, Moha. But here the Moha is the unconscious. The patient becomes unconscious. Udveshtanam Cheshtanashaha. Cheshtanasha means having no activities. Cheshtanasha. Kasa Shwasa Hanugraha Muka. He cannot speak. Gadgada, Akshinimilana, Nimilana, Unmesha, Nimesha. His closed eyes cannot open. Akshinimilanam. Gandaspandanam, Jrimbana, Lalasrava, Swarahanihi, Vadana Jinnatvadiniti. See, this is Shiro Marma Abhigata Lakshana. See here, I have taken up this Moha, Cheshtanasha, Muka, Akshinimilana. Patient is unconscious. Okay, patient is unconscious. How to grade the unconscious level? How to grade the conscious level of any patient in ICU is Glasgow Coma Score. We have Glasgow Coma Score, GCS. So, here, what are the factors to be measured in GCS? Eye opening. See, eye opening, whether the patient opens eye or not. See, Akshinimilanatvam. Okay. So, next is, the second one is verbal response, whether the patient can speak or not. ಹೆಸರು ಏನು ಹೇಳಿ ಅಂದರೆ ಹೇಳುವುದಿಲ್ಲ, ಏನು ಕರೆದ್ರು ಏನು ಹೇಳಿದ್ರು ಮಾತೇ ಆಡಲ್ಲ. ವರ್ಬಲ್ ರೆಸ್ಪಾನ್ಸ್ ಈಸ್ 0. ಸಿ he says ಮೂಕ and the third one you say the motor response, he cannot move his limb, ಕೈ ಎತ್ತಿ ಕಾಲೆತ್ತಿ ಏನಾದರೂ ಕಮಾಂಡ್ ಕೊಟ್ಟರೆ ದೇ ಕೆನಾಟ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ನೋ ಮೂಮೆಂಟ್ ಆಫ್ ದ ಬಾಡಿ. ಯು ಸೇ ಇನ್ ದಿ ಚೇಷ್ಟಾನಾಶ, okay, chestanasha, the total score, maximum score is 15. If a person's score is 15, for me it is 15 because I am all right, I am conscious, alert. So if it reduces, then it becomes 14, 13, 12, like that. So when the patient has come before treatment, the Glasgow coma score was 5, and then the patient has improved to 8, 11, 14 and 15, 100% normal after 1 month. You see the beauty of our science. Moha, patient is unconscious. Cheshtanasha, Mukha, Akshini Milana. So these are the 3 which is there in the Glasgow coma score. How we have to assess the patient of a Murcha. See, this is a patient. So on admission before treatment, so he was removed into peg insertion on the day of discharge and has put on Ray's tube. See, this patient after some 3 days could able to move the limb. Yes. Next you say after 10 days could able to see the mobile. He was, and yes. See, this patient is walking after 30 days after treatment. This was a rejected case from Apollo Hospital. It was a rejected case. He told you take the patient home. So again, the same principles of treatment, Murcha, Pitta Tamapraya. Murcha is Pitta and Tamas. When patient Glasgow coma score was just 5, then we have to treat in lines of the Pitta. So we have exactly done the same Yashtimadu and the what you call Shadadauta Alepa all over the body. And one more treatment what we have administered him is the Sheetala Shirodhara. We have made Dhanyaka and Amalaki Hima. How to prepare a Himakalpana? Dhanyaka, you know, Kottambari. Amalaki, that is the Amalaki powder. So we have made and mixed together, and we have added some 75 grams of that powder, so added with 4 liters of water, stirred and much it with it. Is it up? You have to close it, not boil. Boil means fanta agbidutte. Idu Himakalpana. You have to stir, and then next day morning you have to take the supernated water out and you have to throw out the powder. So that water is considered to be Hima. Hima is the best Kalpana for Pitta. So we have done Shirodhara with the Dhanyaka Amalaki Hima. So Dhanyaka Amalaki Hima Shirodhara, and then Sarvanga Sheetala Lepa with Yashtimadu and Shadadauta Grita. See, Samsrishte, this principle, where to apply this principle? Why? So whether it is, where it is told that you have to treat Pitta first. See, here is a reference in Ashtanga. Samsrishte Kapha Pittabhyam Pittamadau Vinirjayet. If you feel that in a Vata Vyadhi, it is from Vata Vyadhi. Samsrishte Kapha Pittabhyam. Samsrishta means what? If it combines. Samsrishte Kapha Pittabhyam. So if Vata combines with Kapha and Pitta, ಯಾರಿಗೆ ಫಸ್ಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡಬೇಕು? ಪಿತ್ತಮಾದವು ವಿನಿರ್ಜಯೇತ್. ಆದವು ಟು ಸ್ಟಾರ್ಟ್ ವಿತ್ ಪಿತ್ತ ಶುಡ್ ಬಿ ಟ್ರೀಟೆಡ್ ಅಂಡ್ ನಾಟ್ ದಿ ಕಫ. ಸೊ ಸಂಸೃಷ್ಟೆ ಕಫ ಅಂತ ಹೇಳ್ಕೊಂಡು ನೀವು ಉಷ್ಣ ಮಾಡಿದರೆ ದೆನ್ ಅಗೈನ್ ದಟ್ ಪೇಷಂಟ್ ವಿಲ್ ಗೋ ಡೀಪ್ ಇನ್ ಟು ದಿ ಕೋಮಾ. ಇನ್ನು 5 ನಂಬರ್ ಇರೋನು 3ಕ್ಕೆ ಹೋಗ್ತಾನೆ. 3ರಿಂದ ಕೆಳಗೆ ಹೋಗ್ಲಿಕ್ಕೆ ಆಗಲ್ಲ, 3 ಲಾಸ್ಟ್. ಯು ಫಾಲೋ? ಸೊ ಸಂಸೃಷ್ಟೆ ಕಫ ಪಿತ್ತಾಭ್ಯಾಂ ಪಿತ್ತಮಾದವು ವಿನಿರ್ಜಯೇತ್. ಮಧುಯಷ್ಟಿ ಬಲ ತೈಲ ಘೃತಕ್ಷೀರೈಶ್ಚ ಶೇಚನಂ. Sechana ಅಂದರೆ full body, Sarvanga. Shechana can also be done. So Sheetala Parisheka all over the body. I am worried if whole body Sheetala Parisheka with the cold water done, if it develops a fever, then it is again infection, then again it's a complication. So we have done only Shirodhara for some 45 minutes, Shirodhara and Sheetala Parishechan. ಧಾನ್ಯಕ ಆಮಲಕ್ಕಿ ಹಿಮ ಶಿರೋಧಾರ ಯಷ್ಟಿಮಧು ತೈಲ ಶತದೌತಕೃತ ಶರೀರ ಲೇಪ. ಆ್ಯಂಡ್ ಸಿ ನೌ ಐ ವುಡ್ ಲೈಕ್ ಟು ಸೇ ದ ಇಂಪಾರ್ಟೆನ್ಸ್ ಆಫ್ ಏರಂಡ ತೈಲ. ಸಿ ಪಿತ್ತಾವೃತೆ ಪಿತ್ತಗ್ನೈಸ್ತು ಮಾರುತಸ್ಯಾನುಲೋಮನೈಃ, ಕಫಾವೃತೆ ಕಫಗ್ನೈಸ್ತು ಮಾರುತಸ್ಯಾನುಲೋಮನೈಃ. ವಾಟ್ ಈಸ್ ದ ಮೀನಿಂಗ್? See, if a patient, you are Vata Vyadi patient, you are treating with Sheetala. Vatakke ulta aitala adu. Vata is Sheeta. Vata needs Ushna therapy. Vata tatra ruksho laghu sheetaha karaha sukshmashcha loritaha ilva. So when Vata andre ನೀವು Ushna treatment ಕೊಡಬೇಕು. But what we are doing here is Sheeta treatment. Sheeta treatment ಅಲ್ಲಿ there is a threat that the Vata can aggravate again during your treatment. ನೀವು ದಿನ ಕೋಲ್ಡ್ ಮಾಡ್ತಾ ಹೋದರೆ ವಾತ ಮತ್ತೆ ಅಗ್ರವೇಟ್ ಆಗ್ತದೆ. ದಿಸ್ ಎ ಥ್ರೆಟ್ ಫಾರ್ ಅಸ್ ಟು ಟ್ರೀಟ್ ಎ ವಾತವ್ಯಾಧಿ ಪೇಷಂಟ್ ವಿತ್ ಶೀತಲ ಥೆರಪೀಸ್. ಸೊ ಅದಕ್ಕೆ ಈ ಚರಕ ಏನು ಹೇಳ್ತಾನಂದ್ರೆ, ವೆನ್ ಯು ಟ್ರೀಟ್ ಎ ವಾತವ್ಯಾಧಿ ವಿತ್ ಶೀತಲ ಥೆರಪಿ ಮಾರುತಸ್ಯ ಅನುಲೋಮನೈಃ, ಯು ಸಿ ದಟ್ ವಾತ ಶುಡ್ ನಾಟ್ ಅಗ್ರವೇಟ್. ಹೌ ವಿ ಕ್ಯಾನ್ ಸಿ ದಟ್ ವಾತ ಶುಡ್ ನಾಟ್ ಅಗ್ರವೇಟ್? ಓನ್ಲಿ ಬೈ ಮೇಕಿಂಗ್ ದ ವಾತ ಅಂಡರ್ ಅನುಲೋಮನ. ಯು ಕೀಪ್ ವಾತ ಅಂಡರ್ ಅನುಲೋಮನ while you are treating pitta in a vata vyadi. You followed or not? So first when you are treating sheetala therapy, then vata should be under anuloma. When you are treating the kafavrite kafagnaistu, when kapha you are treating with ruksha. Ruksha is also ulta for vata, alva? So we have vata needs snigdha. But we are treating in a Vata Vyadi patient with Ruksha therapies like Dhanyamla Seka, Udvartana, Churana Pinda Sveda. So these are Ruksha. So Ruksha also there is a threat of aggravation of Vata. So in a Vata Vyadi, if you are treating Sheetala therapy, then Varutasya Anulomane. See that Vata is under Anulomana. If you are treating a Vata Vyadi patient with Ruksha therapies, there is again a threat of aggravation of Vata, and you have to see that Vata is under Anulomana. Then how you make Vata under Anulomana? Give Eranda Taila. Tilvagritam Tilvakam Siddham va Satalam Siddhameva va. Payasi Eranda Tailam va Pibe Doshaharam Shivam. That is Payasi Eranda Taila. Eranda Taila is the choice of drug for Vata Anulomana in a patient of Vata. You follow? So the students are asking questions to Charaka. That you are telling Pittahara treatment in a Vata Vyadi. There is a aggravation of Vata with the Sheetala therapy. What to do? He says, Pittavrite Pittagnaistu Marutasya Anulomanaihi. When you are treating with Ruksha therapy, there is aggravation of Vata. What to do? So, see that Marutasya Anulomanaihi. How it is done? By the Eranda Taila. Eranda Taila ಕೊಡಿ. ಅವರು ಮಾಡರ್ನ್ ಹಾಸ್ಪಿಟ್ಲಿಂದ ನಮ್ಮ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಬರುವಾಗ 5-6 ದಿನ ಮೋಷನೇ ಆಗಿರಲ್ಲ ಅವರಿಗೆ. Because they will be bedridden, no bowels. How many times? ಒಂದು ವಾರ ಆಯಿತು ಸ್ಟ್ರೋಕ್ ಆಗೋದ್ರಿಂದ ಮೋಷನ್ ಒಂದ್ಸಲನ ಆಗೇ ಇಲ್ಲ ಅಂತಾರೆ. Is it not? So then if the patient is rails tube ಅಲ್ಲಿ ಫೀಡ್ ಆಗಿದ್ರು ಕೂಡ ಎರಡ ತೈಲ ಕೊಡ್ಬೋದು. But there is every chance that if there is a respiratory distress, then ಎರಡ ತೈಲ should not be given because it is taila. It is a taila, and in acute condition sometimes it so happens that patient doesn't have appetite. Taila grita ella. To digest the thaila and grita, patient should have an optimum agni. So that will not be there. Better you avoid some thaila to start with when a patient is unconscious. Better you can go for a churna kalpana which can be stirred in a water and can be poured in a rails tube. You follow? So this is a way. So Swadishta Virechana churna, illadre Anuloma churna, Anuloma tablet is available that can be crushed and can be put in a water and can be put in a rails tube. So but Vata Anulomana is a must when you treat a patient of Vata Vyadi. So then after that Sheetala therapy we have done the Shirodhara with Ksheerabala Taila later. So every day when Pittaja roll is over, you have to stop Sheetala Abhisheka to the Shirodhara. You should stop when Pittaja roll is over. If you continue, then again it becomes a complication. So once the patient becomes totally alert, in a physiotherapy, if the patient could able to sit and stand with alertness, then you stop the Sheetala therapies. Then we have shifted that Sheetala, the Shirodhara to the Ksheerabala Taila. Shirodhara, Talam with Rasnadi lemon, Sarvanga Dhanyamla. Now comes the role of Kapha and Ama. Dhanyamla Seka. Then once the kapha roll is over, then you can shift to the Abhyanga, Shashtika Shalipinda Sweda and the Anuvasana or Astapana Bastis. So we have patient given with Rasaraja Rasa, Jayamangala when unconscious, the respiratory distress is there, you can add Shvasakasa Chintamani, Trilokya Chintamani also. Then Drakshadi, Mridvikadi are the choice for Pitta, the only two Kashayas, so which can be effectively be given in a patient who is unconscious. Orally to treat the Pitta is Drakshadi and Mridvikadi Kashaya, and Dhanvantara Kashaya and later Ashwagandha Grita was given. So now coming into the third case, that is cervical injury, the post-surgical quadriplegia. So cervical injury, to continue or here now I don't mind. ಬೇಕಾದ್ರೆ ಇನ್ನೊಂದು ಮುಗಿಲಿ ಒಂದು ಕೇಸ್ ಆಫ್ಟರ್ ದಿಸ್. Where is it? See, cervical injury, the post-surgical case, the patient presented with a young boy, aged about 19 years, male. He was doing his second year PUC. He was studying second year PUC. He had a neck injury while diving in swimming. He was swimming and while diving, so he got the subluxation and fracture of cervical vertebra. 19-year-old boy. So C5, C4 burst fracture, cervical 4 and 5 burst fracture. And after the patient was taken up for surgery for the fixation of the vertebrae presented after the surgery. Anyway, before the surgery only he was paralyzed and the surgical intervention was taken and patient was presenting, a boy presented with all 4 limbs paralyzed. Because cervical, all 4 limbs will be paralyzed. Dorsal vertebra, thoracic vertebra, only lower limbs are paralyzed. Lumbosacral vertebra, only 2 lower limbs are paralyzed. But so far as cervical is considered, all 4 limbs will be paralyzed. So this, what is this in Ayurveda called? Ekanga rogam tam vidyat sarvangam sarvadehajam. I have told that Pakshaghata is also called as Ekanga Vata, Ekanga Roga. So, 1/2 of the body paralyzed is Ekanga Roga, 2/2 of the body, 2 halves of the body paralyzed is Sarvanga Roga. All 4 limbs paralyzed is Sarvanga Roga. It is the 2 Pakshagatas, that is the diplegia. It is also called as tetraplegia or quadriplegia. So, this is a concept of understanding. So, high cervical injuries C3, C4, C5. Patient presents with quadriplegia. Okay. So here, if you check, all the 4 limbs will be UMN paralysis. All 4 limbs will be rigid. C3, C4, C5, higher cervical injuries. Higher cervical injuries, all 4 limbs are spastic, UMN. Okay. If it is C6 and C7, there also it is quadriplegia. All limbs are paralyzed, but upper limb is LMN, lower limb is UMN. Upper limb is flaccid and lower limb is spastic. Because the lower limb is supplied by spinal tracts and upper limb is supplied by the cervical motor nerves. So, upper limb ulta, upper limb LMN, lower limb UMN, if in a lower cervical injury. Then comes D1 to L1, L2, dorsal or thoracic vertebra. So, if any one patient has come with D3 vertebral fracture, only both the lower limbs are paralyzed, but both the lower limbs are UMN because it is from the cerebrospinal tracts. And below L2 injuries, anybody who falls from a coconut tree or from a height from the building, etc. So, got injury to the lumbar vertebra. If it is L2 and below L2, only lower limbs are lost, but they are LMN. Because Below L2 there is no UMN supply. You follow? So this is how you can study it later. This is for your information that the possibility of presentation of the patient. So all 4 limbs can be spastic. Okay? So upper cervical. All 4 limbs can be flaccid. It can be Guillain-Barré. Upper limb is LMN, lower limb is UMN, lower cervical. Paraplegia, both lower limbs are paralyzed from D1 to L1, UMN, and below L2 is paraplegia, LMN. So this is a presentation. By looking into examining the patient whether LMN and UMN, you can anatomically say which part of the brain and spine is in what. That is what I have told, that is anatomical diagnosis. See, this is the patient's the motor and sensory scores as per the motor power, then the leg and arm, hand, gait. So it was normally is 27 and before treatment it was 4 and after the 40 days of treatment, so it has become 23. And quadriplegia index of function, so it was 0 to start with, later it has become normal to 30. And the ASI, American Spinal Injury Association Impairment Scale, so it was 0 to 5 to start with and out of which 48/50. Now you can see the, a 19-year-old boy, so who has got burst fracture of the cervical C4, C5 presented with quadriplegia. So after 10 days of treatment, you are so painful and inability to even stand. After 20 days of treatment, he could able to move a bit with the support. Now after 40 days you see how he walks. Now he could able to walk without this support. All 4 limbs were paralyzed totally. Even his bladder also got controlled. He was on the catheter to start with because autonomous nervous system will also be involved. So there is no bladder control before the treatment. See the same line of treatment. Dhanyamla Seka, we have done Churnapinda Sweda, then Agni Chikitsa Lepa we have done. Then this is I have already explained the Ruksha Chikitsa and the Yerenda Taila Prayoga. Agni Chikitsa, I have a slide of ingredients. Next, I have a slide. So, Yerenda Taila Prayoga. So, brief about Yerenda Taila Prayoga. So, this is the one which gives the maximum result in your patients. The one Yerenda Taila Durbalopi Mahadosho Virecho Bahusho Alpasha. So, drastic Virechana you cannot give, classical Virechana and all. So, Bahusho Alpasha. So, Stoka Dosha Nirharana can repeatedly be done with Yerenda Taila. Then action Yerenda Taila is Sukshma Sroto Vishodhana and Medha Smriti. So in all neurological cases the cognitive impairment is possible with Yerenda Taila and Vata Kapaharam Adobhaga Dosharam. Then what is the dosage? It is Mrudu Madhya Krura Koshte Karsham Ardhapalam Palam. This is a Vangasena reference. Balakoshte Vyadivashat Panchapala Bhaven Matra. That is Mrudu Koshta, Madhyama Koshta, Krura Koshta. You can advise Karsha Ardhapala Phala. So to start with from 10 to 50 ml, 50, you can advise to the patient. so that patient will have 3 to 4 times bowels per day. So 7-8 times every day you cannot give because the patient's strength will be lost. So 2 to 3 times if the Koshta Shodhana is done, Vatanilomana is done, the result will be best. So Tailam Yerendajam Vapi Gomutrena Pibendra Masamekam Prayogoyam Utrasyu Acharya says, so somebody asks why you have given for 10 days. Every day, 10 days, you can give Erenda Taila to the patient. See, we have a reference in the classics in the chapter of Budrasi that Masamekam Prayogoyam, 1 month also you can administer the Erenda Taila to the patient. And if you go to Udara chapter, 2 Masauva, 2 months also he gives permission for us to give Erenda Taila to the patient. So minimum 3 days, maximum depending upon the condition of the patient. So this Erenda Taila, giving Erenda Taila to the patient and having the result and getting results is a matchless. So if a Parkinson patient comes, the disease starts in the gut. So if you give Erenda Taila, within 3 days the patient starts walking 1, 2, 3, 4, 5 steps, who is bedridden, freezing gait, so such. So Erenda Taila, you should know how to give. Either you can give with water, or in a Vata Pittaja case you can give with milk, or you can give with Shunti Kashaya, Nagarena. So Shunti Kashaya, and worst case with Kapha, Ama, then Gomutra can also be a choice. But patient doesn't like to have it with Gomutra. So next comes the Nirupastamba, Kevalavata. After treating Pitta, after treating Kapha, Ama, next you have to treat the boss. It is a Vata. So here you can go for Snehana, Svedana, the Mastishka with Taila, Tailadhara, Kshirabala Taila, Dhanvantara, Mahanarayana Taila, Shirodhara can be done for the cervical lesions because patient will have autonomous dysfunction. So he had severe giddiness when he used to sit. So we have made the Eshtimadu Taila Pratimarshanasya to the patient. A Marshanasya we have not done because say sudden sneezing etc. can injure the cervical. So Pratimarshanasya we have given. Then Taila Seka, full body, Taila Seka, Physical and Abhyanga, Shastikashali, Shamanasneha can also be given. Mrudu Shodhana with Erenda Taila, so Anu Taila, Dhanvantara Taila, then Pratimarshanasya can be given. Basti, Vatahara, Vyadihara, Yapana Basti, Mustadi, Yapana Basti can be given. So here he says, Kevale, Pavanavyadu, Snigdha Ushnam Bhaksha Bhojanam. That is, Snigdha and Ushna. Whatever we have done is the Ruksha and Shita. Is it not? To start with Ruksha and Shita we have done, but once all the gates are open and you have reached Vata, then start treating the patient with Snigdha and Ushna therapies. So now, see what we have done to this boy is we have prepared 100 liters of the Dashamula, the Taila, Dashamula, Balamula, Yerandamula, Rasna, all Kashaya. In our own pharmacy, I have asked our pharmacy in charge to prepare 120 liters of oil, and we have given a Sarvanga Taila Droni. This boy, because he is just 19 years, his life is so long, and we have to make him to walk, right? Then we have prepared a Taila Droni, we have immersed the patient in a Taila Droni, that is, the next photo is Taila Seka, Physical, what you call Sarvanga, like Dhara with a Taila, and we have done it. So in Avagaha Sweda, this is Avagaha Sweda, Ekantaram Dvyantaram Va. So you have to have this Avagaha Sweda alternatively, not every day for 21 days. So you have to make Abhyanga to the patient and immerse the patient in the oil bath, whole body, Sarvanga. Avagaha Sweda was done for 21 days, alternating with the either Shastika Shalipinda Sweda or Abhyanga, you can do this. So this patient with these therapies, so Salvana Upanaha we have done Shastika Shalipinda Sweda and Shastika Shali Annalepam. Physically Taila Seka. No, not with that Sneha, it is Kshirabala and Dhanvantara. Dhanvantara is the best Brahmana Taila. But Masha we can do, but it is little costly for the Abhyanga and not for Abhyanga, like Taila Seka. Masha Taila can also be used. We need nearly 8 to 10 liters of oil for Taila Seka. 8 to 10 liters of oil for Taila Seka. So now coming about the Basti. See, if you don't say about Basti in a Vata Vyadhi, then you are missing a rose in a garden. You are missing a rose in a garden. If you don't say about Shilajati in Prameha, you are missing a rose in a garden. Atara, what should not be forgotten is a must to know. Must to know what should not be forgotten. So Basti is the matchless therapy, so which have to be done in a patient of Vata Vyadhi. But see that your Pitta, Ama, Kapha has given permission to you reach Vata, then only you start with Snigdha Ushna, and this Basti therapy is the must therapy for a patient. So you have choice, like Anuvasana Basti can be given with any Thaila, Grita, and even Vasa Majja with Mahasneha. We have from Vaidyaratnam pharmacy, Mahasneha is available. All four snehas together. You have Trivritta Sneha, Mahasneha. Mahasneha is all four snehas together. So that can also be given as a Anuvasana Basti. Niruha Basti depends. If you are treating the Vata Vyadhi patient at Kapha stage, then Vaitarana and Kshara is beneficial. If you are treating after Kapha Ama stage, you can choose Vipancha Muladi, Eranda Muladi. If there is an involvement of Rakta, then you can opt for Ardhamatrika Basti. Then Panchaprasartaki, totally Brahmana with Kshira, Madhu, Grita, Taila, like, so this is Panchaprasartaki Basti is Varnakaraha Vata Hrit. So Vatara Brahmana Basti is Panchaprasartaki Basti. Then Mustadi Yapana, Kshira Kashaya can be prepared or Mamsarasa can be added for Yapana Basti. So Hapushadi Yapana, like your choice to what stage you are taking the patient for the treatment. So I was telling Basti is a matchless medication. So age 0 from children to elderly, any age, Janma, is it not? So any age you can give. So for male and female you can give. For lean, obese, all Prakriti you can give. For all dosha, vate, cha pitte, cha kafe, rakte, prashastyate, samsarge, sannipate, cha bastireva hitah sada. For all doshas you can give. It's not that it is for vata and you should not give it for kapha and meda. You have permutation and combinations in the medicaments which can be used for the therapy. Then for rasa to shukra, any dhatu you can give. For shukra, even vrishya, vajikarana basti you can give. Any injuries, fracture, dislocation, deformities you can give basti. For health status, healthy also you can give yapana bastis, diseased also you can give. Then illness, shiras, hridaya, basti, sharirika, manasika, any vyadhi you can give. So basti is a sarva chikitsa. Basti is a sarva. Why it is sarva chikitsa? Vata is the leader. The boss ಹೇಳ್ತಾರೆ ಅದನ್ನು ನಾವು ಕೇಳಬೇಕು. Is it not? Vata is a leader. You have to see that boss works properly. Then everything will be alright. So you have to give treatment that is the basti. So for all purpose, the basti is the treatment. So then brief for the students how the basti, how you can make basti. This is a common protocol and you can change it according to the patient's need. So one is Anuvasana Basti in Vata Vyadhi, you can choose Dhanvantara or Mahasneha, Mahamashataila, Ashtadashanga Mashataila, Ashwagandha Grita, any Taila of choice for the particular as per the need of the patient. Then in adult patient, what is the maximum quantity of the Basti? Dwadasha Prasartaki Basti. What is Dwadasha Prasarta? 1200 ml. Now nobody is practicing Dwadasha Prasartaki. 1200 ml is rarely given. Max to max Padahina Basti, 900 ml, 1/4 is reduced. Padahina, that is 900 ml can be given, or in a routine practice. So 900 also you should have a good observation. Good observation should be there, good supervision should be there. But with no complications, you can advise the patient 650, 700, 750 ml of regular Basti in the hospital condition. So here you can have half of Dwadasha Prasarta, 600 ml ಗೆ ಒಂದು ಬೇಸ್ ಸೆಟಪ್ ಮಾಡ್ಕೊಳ್ಳೋದು. 600 ml ಗೆ ಒಂದು ಬೇಸ್. Then you can increase the madhu to the extent if it is a kapha, then meda more. If it is a vata more, you can add more of snehas, like that. So in a Dwadasha Prasartaka Basti, the honey is 200 ml, 2 Prasarta. So you make it half, 100 ml. Then in a Saindhava Lavana, Dwadasha Prasartaki Basti, 1 karsha, 12 grams, you make it half, 6 grams. Then comes the Sneha. Sneha is 300 ml, you make it half, 75, 150 ml or 140. All 2 Snehas can be chosen, Grita and Taila together can be used, only Grita can be used, only Taila can be used, but you maintain that quantity so that Basti will have its effect. Then comes Kalka, 30 grams, one Prasarta is a Kalka, half is 50 grams, but Churna if you take 30 grams, add water, weigh, then it becomes 50 almost. So 25 to 30 grams of Churna added with water can be of 50 grams. Then Kwatha and Avapa Dravya is together the 600 ml, that is 400 plus 200, 400 Kwatha and 200 ml Avapa, you can make it 300 ml. Or if you want to increase the dosage of the Basti from 600 to 700, you can make together 400 ml. So the Kwatha, like Erenda Mooladi Basti Kurtiradre, Erenda Mooladi Kashaya is available in the market. You prepare Kashaya out of it, 300 ml, and add, if you want in a Kapha Medo condition, 100 ml Gomutra. If you are for Vata and Pitta, add Kshira. If you are purely Vata, then you can add Dhanyamla. Likewise, you can add Avapa Dravya, but you maintain this minimum dosage to be given as a Basti. If 300, 350, 400, it doesn't work at all. So minimum 650, 700 ml should be given to the patient. So Kshira, Dhanyamla can be added. In Kwatha, Erenda Mooladi, Mustadi Apana Basti, you get Mustadi Apana Basti. The Kashaya packet is available. In that there is a sachet. ಈಗ ಮ್ಯಾಗಿಯಲ್ಲಿ ಒಂದು ಸ್ಯಾಚೆಟ್ ಇರೋದಿಲ್ವಾ, ಆ ಥರ ಅದರೊಳಗೆ ಒಂದು ಸ್ಯಾಚೆಟ್ ಇರ್ತದೆ, ಅದು ಕಲ್ಕದ್ರವ್ಯ. ಸೊ ದ್ಯಾಟ್ ಕಲ್ಕದ್ರವ್ಯ ಯು ಕ್ಯಾನ್ ಆ್ಯಡ್ ವಾಟರ್ ಆ್ಯಂಡ್ ಕ್ಯಾನ್ ಬಿ ಯೂಸ್ಡ್ ಆಸ್ ಎ ಕಲ್ಕದ್ರವ್ಯ. ಸೊ ಕಷಾಯ, ಕ್ಷೀರ ಕಷಾಯ ಕ್ಯಾನ್ ಆಲ್ಸೋ ಬಿ ಪ್ರಿಪೇರ್ಡ್. Then Dashamuladi, Hapushadi, depending upon the availability of the drugs and availability of the medications, you can use. So here how this Basti works in neurological condition. Yaiva Pittadara, Saiva Majjadara iti. What is brain? What is Mastishka? How it is explained? Ardhavilina Gritakaro Mastaka Majja. Ardha, anatomy. You know, right? Anatomy, first years, sleeping. Ardha Vilina Gritakaro Mastaka Majja. Mastaka Majja is Ardha Vilina Grita, semi-solid. Gritakaro Mastaka Majja. So that is why Majjadara, Majja, brain. So here Majja is compared to the brain and Majja is also compared to the bone marrow. That is different. Okay, so this Majja is compared to the brain. So whatever Pittadara is in the Grahani. Pittadara Kala is in the small intestine. So the intestine is considered to be Pittadara and Majjadara is brain. So whatever gut speaks, the brain should listen. That is what known as the gut-brain axis. Nowadays, all modern doctors, they are also telling there is a gut-brain axis. Whatever gut speaks, when you give Basti to the patient, gut starts speaking. Is it not? Then the brain should listen. Andre illi kotta command alli apply agbeku. So the Basti will work for all neurological disorders. There is one more concept of microbiota of the gut. So there are the commensals in the gut. So many microbes into 10 to the power of 12, 9. So such microbes are there in the gut. So these microbes will produce the varieties of the proteomics, metabolomics in the body. So that will run in the serum in causing the diseases. So many modern researches are now being attributed to the microbiota of the gut. So if such a drug is administered, what is the status of microbiota? What is the status of proteomics and metabolomics released by the microbiota? So they are all working on the drugs and microbiota in neurological condition. See, this feces and microbiota has, the researchers have extended to such an extent that the feces of an individual will tell you what disease next he will going to suffer from. This is a research update. So So what they have done is, the palate of the feces is implanted into a deceased intestine from a healthy individual. And the feces palate as a medicine, it is introduced into the gut of a healthy individual, into a deceased person from a gut of a healthy individual. As a therapeutic module, see how our acharyas have told, that is sarve rogaha mande agnau sutaram udara. Every disease starts from the gut. Now the science is coming back to the gut in the disease process. So whatever the virechana you give, the gut microbiota will change. Whatever nitya virechana you give, whatever basti you give, whatever you give to the gut, so it will change the gut microbiota and it will change the disease pathological process. So a mutualistic synergy between the microbes and human is essential for growth, development, health and prevention of diseases. Sir, we will take a break. See, are you okay? Let us continue with some two more diseases, 2-3 diseases. Tired? We will continue with the presentation. So this is a patient of 73 years old male, presented with tremors. The condition was Parkinson's disease. We call it as Avaranavata Vyadhi. Just brief about Parkinson's disease. So it's a progressive dopaminergic neurodegeneration, a degenerative neurological disorder. One example I have taken. At the substantia nigra, the dopaminergic nerve degeneration takes place, resulting in Parkinson's disease. So here it is characterized by the motor and non-motor features. You can call it as Kampavata. So here it is also called as Vepatu by Madhava, Sarvanga Kampaha Shiriso Vayuhu Vepatu Samjnakaha, or else by Basavarajiyam. He told a classical clinical feature of Kampavata, Kara Pada Thale Kampo. There will be tremors in the Kara and Pada Thala. Deha Brahmana. Deha Brahmana means giddiness or imbalanced, inequilibrium while walking, the trend of fall. Deha Brahmana Dukkite. Nidra Bhango Matihikshina. The dementia happens, Matihikshina. So the patient develops the Parkinson's dementia later after 7 or 8 years of Parkinson's disease. This is called as Kampavatasya Lakshanam. These are the primary motor features. Patient presents with the trap, that is tremor, that is the static tremor. When a patient is sitting not under work, he will develop the tremors. Rigidity, the body becomes rigid and you see the stuporous. The patient will be like this, stupor posture. And echinacea means his activities will be slowed down. The patient party says he or she walks very slowly. All her activities are dull, slow. You say hypokinesia or echinacea. And postural instability. The patient cannot stand and walk without the stability. So with stability the patient cannot walk. There is a trend of falling. You can see the pictures. The secondary motor features like hypomimia. Hypomimia means expressionless face. So even if you laugh, the patient doesn't laugh. There is no expression, doesn't smile. So even if it is then cry, so no expression, laugh, no expression. Hypomimia, masked face. So hypomimia. Dysarthria, the speech is also disordered. Dysphagia and cyanoria. Dysphagia means difficulty in swallowing. Cyanoria means dribbling of saliva from the angle of the mouth. Micrographia, that is what he writes becomes small. That is, his signature was quite big to start with, and after developing the Parkinson's disease, the signature becomes very small. Micrographia, all the writing letters becomes small. And shuffling gait, festination gait. Festination gait means the patient walks very fast, very quick steps without having swinging movements of the arms. So as if his gravity is catching his gravity. The gravity line falls in front of him, not in between the toes. So he walks very fast, festination gait, and if you ask the patient to come back, we'll have a military gait, military turn, 1, 2, 3, he'll come back. You follow? So festination gait and military turn. And if the condition becomes severe, there can be freezing. He never walks. He thinks, if you ask the patient to walk for one step also, he thinks 15 minutes if you stand also, he will not walk for a step. You call it as freezed gait. If the condition worsens, later he becomes bedridden and all. So dystonia, some patients, rarely some 5% of patients with tremors will develop the dyskinetic movements. That is, I told some dancing movements of they are all dyskinesia, involuntary, the movement dystonias, and the repetitive glabellar reflexes. Then non-motor features like autonomic dysfunction, that is inequilibrium, or then the sensory features like anosmia. It is said that some 3, 4, 5 years before the patient starts developing Parkinson only, he can't appreciate the smell. That is the first clinical feature to develop constipation and the anosmia. Then paresthesia, numbness, tingling sensation, sleep disorders, disturbed sleep, because this is the one, constipation is the one which aggravates vata, having no sleep is the one which aggravates vata. Like all first clinical features, mild clinical features develops at first. Cognitive abnormalities, the intellectual power, memory, etc. starts declining, and neurobehavioral abnormalities will be seen. So if you grade the patients you have a grade known as UPDRS, Unified Parkinson Disease Rating Scale. So the patient had to start with, the normal is 16, the normal is 0, and the maximum is 16. So before treatment it was 11, and after 21 days and it has become 4. So these are the activities of daily living. Every patient of neurological disorders, we score for activities of daily living. Daily living means whether he speaks normally, salivation, swallowing, handwriting, dressing, hygiene, turning in the bed, adjusting bed cloths, falling. So all these we judge and give grades. So to start with it was 34, and after 21 days it has reduced to 30. So these are the motor examination. So you can see the patient after 7 days of treatment, he was totally bedridden when he was brought, and after 7 days of treatment he could able to just get up with a freezed gait, and after 21 days he independently, so with a walker he could able to walk. The treatment options we have, like successively for 3 students in a post-graduation, successively for 3 students. So we have given the dissertation work, thesis work on Parkinson's disease. We have given a protocol of treatment. So one group patient with Dhanyamlaseka, Abhyanga, Shastikashali and all, one group, and another group with Churna Pindasweda, Abhyanga and all, another with the Sahasradi Taila, Pana, Sahasradi, Abhyanga and all, 3 groups. Almost in a classical manner we have studied 90 patients, 30 patients in a group. So we have ended up with some protocol of treatment wherein Churna Pindasweda first and next by Abhyanga it works better than all other groups. So you can have Churna Pindasweda with Kola Kulantadi and Trifala Churna. So when the patient is rigid, so you know the patient will have cogwheel rigidity. Cogwheel means as a wheel, tuck, tuck, tuck sound wheel. So likewise if you ask the patient or if you open the limb, so it will like a jerk, like cogwheel rigidity. So in the stroke it will be clasp knife rigidity. You follow? So in Parkinson's it is the cogwheel rigidity, the spine will be stupor like this, it is rigid. So the whole body will be rigid. That rigidity is due to Kaphavrta Vata. Why it is not pure Vata? Stambha is a clinical feature of Vata, pure Vata, and the tremor is a clinical feature of pure Vata. So hypokinesia, reduced movement is a feature of pure Vata. Then why you want to consider it as Kaphavrta Vata? Why? Because the Vata Vriddhi Lakshanas and Vata Kshaya Lakshanas seen in a single patient is a hallmark of Avarana. See, this is a Chalaguna of Vata Vriddhi, it is a Kampa. So, having no movement, reduced activity is Vata Kshaya. Okay, so hypokinesia is Vata Kshaya. But yaru fast ಆಗಿ ಕೆಲಸ ಮಾಡ್ತೀವಿ ನಾವು ವಾತ ವೃದ್ಧಿ ಆದ ಹೋಗ್ತಾನೆ. Is it not? When he works, very slow kapha ಅಂತ ಅಲ್ವಾ? See, you imagine when a person activities gets to slow down, it is Vata Kshaya. So, Vata Kshaya slow features in a patient and Vata Vriddhi Chala. So, Vriddhi and Kshaya together in one patient in a one disease is a hallmark of Avarana. So, you have to treat for Avarana here. So, we have started with Churna Pinda Sweda, with Kola Kulata and Trifala, and later followed by the Abhyanga and Nadi Sweda. So, best drug for this is Ashtadashanga Mashataila. Mashataila is a choice for the degenerative condition. So, Shirodhara, when he is moving into a stage of the Parkinson's dementia, then you can add some Brahmi Taila to the Kshirabala Taila or Dhanvantara Taila for the Shirodhara. Then Yeranda Taila Prayoga, Yeranda is the best to remove the Stamba. So even in, in Amavata also, he says Yeranda Taila. Amavata Gajendrasya Sharira Vanacharinaha. Is it not? Eka eva nihantyashu Yeranda Taila Kesari. So Yeranda Taila, in Vata Vyadi, Amavata, to remove Stamba, it is a choice. So the Yeranda Taila Prayoga should be done minimum of 3 days. So the patient starts, so if the patient is not walking properly, will get up and walk 1 or 2 steps. Okay, so all these activities, the hyperactivity will come down when Vata will come under control. Next, Mustadi, and speech improves a lot with 1, 2, 3 days. If you give Yeranda Taila, the speech, what was very abnormal, will become normal in a patient of Parkinson with Yeranda Taila. So, Mustadi Yapana Basti with Mahamash Taila as Anuvasana can be administered. Mahamash Taila Anuvasana followed by Mustadi Yapana Basti. In a Yoga Basti, Kala Basti pattern you can give. I have told how to frame a Niruha Basti in the last slide. So, Nasya, Kshirabala Taila Nasya can be given, or now there is one more research product known as Vemsa nasal drops. It will hit the dopaminergic area for the development. So, dopaminergic degeneration. So, Vemsa nasal drops was established by some pharmacy, can be effectively used. Then, Gandharvahastadi Kashaya and Bala Sairayaka. Bala Sairayaka Kashaya is beneficial whenever there is an imbalance in walking. So, it's a clinical, there is a condition known as Parkinson plus syndrome, atypical Parkinsonism. This is a typical Parkinson's disease. There are some 5 to 6 disorders which are atypical. So, whenever the imbalance is more, whenever the patient's cerebellum is involved, cerebellum is for the stents and equilibrium is done by the cerebellum. When equilibrium is lost, then Bala Sairayakadi Kashaya will be helpful. Then if you go on giving Kashaya to the patient, Kashaya Rasa is Stambhana and causes aggravation of the Vata. So, don't give Kashaya totally throughout whatever, for how long the patient comes for the follow-up. Don't administer Kashaya for long. You can change it to the Asavarishta like Ashwagandha Arishta, Bala Arishta, Draksha Arishta, like other Arishtas also you can administer. Then Varmi Taila has the only Palashruti of the Kampavata. Uttara Mula, that is the Mula of Indravaruni, which is moving towards the Uttara, that is a north direction. So that has to be cut and Taila should be prepared, and it is considered to be the Taila of choice for the Kampavata, Shira, Pada, Kampa. So this Varuni Taila is beneficial. Already the dissertation work have been done in Dravyaguna department of our college, and even clinical study with here also we have done Varuni Taila in the clinical study. And Maha Kalyanakagrita Shamana Sneha is a choice for the patients who are going for cognitive impairment with memory, intellectual power, etc. Kalyanakagrita Sneha Pana. So one PhD work was done in Kerala on Maha Kalyanakagrita Sneha Pana. The Pancha application, 5 types of application, Abhyanga, Nasya, Sneha Pana, Basti. So like 5 applications have been done. So Vilvadi Gulika is a choice because so everything, the Vata aggravates and the degenerative pathology starts with what is known as Visha, that is Dushi Vishas. Dushi Vishas, so Vilvati Gulika, which will improve the and it remove the, it has got Vishahara property, and Shadharana is a choice for Kapha and Ama in any system of the disease. And Brahmivati is also beneficial for cognitive impairment, and a combination of Ashwagandha, Kapikachu, and Kapikachu, you know, it's used since long because of its dopamine content, so dopaminergic, Zandopa are used. Whereas Tambra Basma, Bhunaga Sattva, Tambra Basma is highly used in the clinical practice, but we should be given with caution. And Abraka Basma is also Brahmana in nature, are all degenerative vata vyadis. Then Brahma Rasayana, Bhargava Prokta Rasayana and Shilajatu Rasayanas are the choice. Why? Because Brahma Rasayana and Bhargava Prokta is nothing but Amalaki Rasayana, which is told in the Vata Vyadi chapter. So these two are Brahmana Rasayana. If you divide the patient of Kampa Vata into two groups, one is Kampa Pradhana and another one is Stambha Pradhana. So Kampa Pradhana is more of Vata, Stambha Pradhana is more of Kapha. So when it is Kampa Pradhana, more tremors is dominant, then you can choose the Brahma Rasayana or Bhargava Prokta Rasayana. When Stambha is more, Kampa is less, then you can choose Shilajatu Rasayana. STM Udupi has established one Rasayana out of Shilajatu, that is Guru Rasayana. Research work have been done, Guru Rasayana with Shilajatu as a major ingredient. That works very nice in the treatment of the Kampavata. So next case is Guillain-Barré syndrome. We had a patient, so good number of cases are coming. Even last some 6 months back in Pune, there was a hit of GB syndrome patients. So it is acute inflammatory demyelinating polyneuropathy, acute, suddenly. So this patient, here the immune system attacks the peripheral nerves, not central nerves. It is a peripheral nerves gets attacked by the immune system, and it is triggered by GIT infection or even by the respiratory infection or the vaccination. So patient gets a fever 4, 5 days, 6 days. Later suddenly develops paralysis of all 4 limbs. The paralysis followed by the fever is usually a Guillain-Barré syndrome. Here it is a quadriparesis where all the 4 limbs are lower motor neuron type. So difficulty speaking, it is a paralysis which ascends from the lower limb to the upper limb. First lower limb gets paralyzed, later after some hours or days, the upper limb gets paralyzed and respiratory muscles gets paralyzed, breathing difficult, swallowing becomes difficult. Likewise, it is a paralysis which ascends from lower limb to the upper limbs. So the modern treatment which is available is plasmapheresis or plasma exchange and intravenous immunoglobulin IV injection. So this costs a lot. So patient takes the IG immunoglobulin IV injection 2 lakhs, 3 lakhs for this injection. So some patients having no affordability will come, or some after having injection even the disability persists and they come for the treatment. So you have a GBS disability score. You can see this patient, he was totally bedridden to start with, and then after 20 days, then after 50 days, and after 70 days of treatment, the patient could even walk over the stairs. Totally he was 4 limbs paralyzed, all 4 limbs are lower motor neuron. So contrary to all 4 limbs are upper motor neuron in that boy who had a cervical burst fracture. All 4 limbs are upper motor. Here peripheral nerves are attacked by the immune system and triggering factor is a viral infection. So you have administered him, started with Agni Chikitsa Lepa. See, Agni Chikitsa Lepa is again one more modality of treatment which is Kapha and Amahara, like Churna Pinda Sweda, Udvartana, Dhanyamla Seka. One more modality of treatment which is Kaphahara is Amahara is Agni Chikitsa Lepa. Then after the Kapha, so patient is conscious, no conscious is altered, so no Pittahara line of treatment is followed. Directly Kapha Ama is treated, and then we have treated the Vata, Kashaya Seka, Taila Seka, Shashtikashali, Salvanopanaha, Eranda Taila Prayoga, which is must, and then started with Eranda Muladi Virohabasti, one course, and next one more course of the Mustadi Apanavasti. So, oral medication started with Amrita Arishta, is Jwara line of treatment, Jwarahara, because in Jwara, the Acharyas have told, Jwarado Langanam Proktam, Jwara Madhye tu Pachanam, is it not? Jwarante Beshajam Dadya, Jwara Mukti. Why Virechana after Jwara? Because toxic effect of the virus, bacteria will be there in the body. To remove the toxicity after the fever, the Virechana have been advised. So, to remove the toxicity, so this can be administered. Indukanta Kashaya. See, Indukanta Kashaya is Deepano, Pachano, Paramaha, the most best. And it is Indukanta Kashaya prepared into Grita is Nimnonnata Jwaraharam. Then Jwara Klamaharam. So after Jwara, whatever the toxic effect is seen in the body, the Indukanta is a choice. So Indukanta Kashaya, Amrita Arishta, then Abraka Pravada for all degeneration, demyelination, degeneration, Abraka Basma is a choice. It is a Brahmana Rasa. Then Swarana Malini Vasanta, then Kshira Bala Taila, Ashwagandha Arishta, Bala Arishta, Ekanga Virasa were given. Sir has asked for Agni Chikitsa Lepa slide, sir. So it's a very traditional, when I was doing my UG BAMS in STM Udupi, so we have witnessed and it is going on since long, this procedure, most Kapahara line of treatment. Ama, Kapha, to start with any paralysis, you can administer Agni. But you should be very cautious if you are applying it for a patient with diabetes. Sometimes they may get some irritation like Udvartana, but otherwise it can be practiced. Nirgundi, Agrimanta, Vanatulasi, Papata and Banda. These are the fresh leafy drugs you have to prepare. At least for one patient we may have to have some 200 or 250 grams of each. Fresh leaves. So Papata and Banda we don't get it. So we take only first three, Nirgundi, Agnimanta and Tulasi. And rest of the things, Maricha, 9 in numbers, 9, Maricha Kadu, 9 in numbers, then Lavanga, Lashuna, Haridra and Sarshapa. Haridra, Sarshapa 5 grams. And all these are made into paste and applied in 3 ways. One is 5 grams orally it is given, and 1 to 2 spoon it is kept in bregma as a thalam, and whole body is applied with the labor. And it is kept for some 45 minutes to 1 hour and ask the patient to wash it off. It is a pure Kapahara in a case with Vata Vyadi. Vata Vyadi, Kapahara line of treatment. And it can also be used in other conditions of Pakshadata. Ama Vata it can be used where Kapha and Ama and Vata. So Agni Chikitsa Lepa can be used. So once Agni Chikitsa Lepa for 3-4 days over, Kapha Ama role is over, then you start with the Abhyanga like that. Vatahara line of treatment should be followed. So next case, Ardita, sorry, R is missing here, Ardita. Okay, so here you have seen patients, Vakri Bhavati Vaktrardham Nivashchapi Apajyati. That is, half of the face gets distorted or asymmetry is seen. So the choice of treatment is Nasya. Ardite Navanam Murti Tailam Tarpanamevacha Nadi Svedopanaascha Anupa Pishtairita. So here is a case of Ardita where the patient had some, suddenly she was like traveling in a car and opening the window, and he had cold exposure to a long, then later developed the facial palsy. So you know that classical features I have already explained. So frowning of the forehead, ask the patient, close the eyes, puffing the cheeks, is it not? Oh, see, all these are checked and then started with Nasya. Nasya for trigeminal neuralgia, facial palsy and all, Shadbindu Taila is a choice. So once the Shadbindu Taila is applied, and after that, after Marshanasya, Pratimarshanasya to be followed. See, what I should never forget in telling about Nasya is that Nasya should be, as a Marshanasya should be followed in Bindu Pramana. What is one Bindu? Huh? What is one Bindu? No, you tell me the metric measurement so that I can put it in the nostril of the patient. Huh? 0.5 ml, 0.5 ml, half cc. half cc, you give injections, no? You can draw in a 5 cc syringe or 2 cc syringe, you can draw to 0.5 ml is 1 bindu. What is the dosage? Pravara matra is 8 bindu is 4 ml you have to put into one nostril and 4 into another. ml. 4 ml. Okay, so suddenly day one giving 4 ml to each nostril may get irritation. So you can start with the Krisiyasi matra of 0.5 ml every day to each nostril, and then you can second day increase to 1 ml, 1.5, then you can increase to 2, 2.5 and 3 ml. So I have not given 4 ml to any patient, maximum 3 ml of Nasya. So if you have a 10 ml bottle of Anudaila and give it for all 7 days, one bottle still some oil is left, then it is a total waste Nasya procedure. You followed? It is a total waste, Nasya procedure is a total waste. So you have to have 0.5 ml. You have to draw and put it in a kalade bartan. So that you have to have. Otherwise, you want directly from the syringe also, without avichinna daraha, you can give it to the, instill into the nostrils. So if you perform in that manner only, the Nasya will give the result. Otherwise, no use from the Nasya procedure. Then talam is rasnadi churna mixed with the lemon and it is kept over the begma. So here talam, then it is the best for, it removes the shitala effect of the shiromarma. So it is the best. And kshira dhuma for the speech defect or for the tongue. So kshira dhuma, kshira balamula, kshira kashaya is prepared and the tongue is rubbed with lemon, vacha and honey, and then a steam is taken. So that is best for the facial muscles, the effect over the Brahmana effect over the nerves. Then what is a very special medication in the Ardhita is that Lashuna Prayoga. Rasona kalkam navaneta mishram kadhennaroyo ardhita roga yukta. Tasyaditam nashayati hashigram vrindam gananamyo matarishva. That is Lashuna. Lashuna kalka should be prepared and it should be mixed with navanita or butter and ask the patient to take. So this minimum of 10 grams Lashuna kalka to be given with navanita. See, even STM Udupi, they have made a preparation of Lashuna Rasayana capsules, a concentrated Lashuna, and even Vardhamana Lashuna Rasayanas are also administered in a Rasayana quantity, not in a Shamana quantity. So it's also available in the market for your prescription. Then Panasapatra Sweda, you know Panasapatra from the jackfruit leaves. So it can be dipped in the and heated and dipped in the oil and you can rub over the face for the Ardhita. Then Auttara Bhaktika Snehapana. So after food, the Snehapana should be. Usually Snehapanas are done on empty stomach, but here in this case Acharyas have mentioned Auttara Bhaktika Snehapana, because the Urdhva Jatrugata Vikara Udana Mata is involved. Udanam Yojayet Urdhvam Aparam Anulomayet. So Udana Mata Vikriti Auttara Bhaktika Snehapana has been told. Diabetic polyneuropathy. So don't worry, I will stop by one. Be patient. Huh? 1 sir? 9 to 1, actually 10 to 1 college? 9 to 1. So 1 o'clock I will finish. You can have your food. Diabetic polyneuropathy. Diabetic, yes. 8 to 1. 8 to 5. We used to go by 7:30 in the morning. Udupi SDM, you know. So final years 7:30 we should reach the hospital. Huh? So don't worry. So diabetic polyneuropathy, a patient having the sensory neuropathy and the myelopathy together, polyneuropathy, muscle power is lost and numbness and tingling sensation is there. So this is called as Pada Daha and Pada Sukti, Harsha. It is again a Vata Vyadhi, where the Pada Daha is Pitta, but it is a Vata Vyadhi, where it is the Vata takes the Pitta into the Pada to produce the Daha. You followed? Anyasthanagata dosha, you have read in the Samprapti. So Pada Daha is Vata and Pitta, Pada Sukti is Vata and Kapha. So for Pada Sukti, numb, the patient says, I don't know where I have kept my leg, I cannot appreciate that I have kept it on the floor. Pada Sukti cannot appreciate. So if that is lost or numbness is there, then Udvartana is a choice. So Udvartana again Kafahara. So Sukti is Vata Kapha, Daha is Vata Pitta. The treatment for both the conditions are different. So when it is Pada Sukti, then Dhanyamla Seka, Udvartana, and after that Abhyanga will work, Taila Seka, and Takradhara is the very important treatment here. Takradhara, that is Takra Shirodhara, so that it will improve the peripheral circulation and it will improve the numbness. Then Gokshura Navanita Lepa. Gokshura Churna can be mixed with butter and can be applied over the area of the Sukti. Then for Daha condition, Shadadauta Grita, Yashtimadu Taila, Dhanvantara Grita, Balaguluchadi Taila can be applied, and a Basti treatment. So we have established in the sense, a dissertation work was done on 60 patients with the Anuvasana Basti with Ashwagandha Grita and Madhu Tailika Basti were administered for a diabetic neuropathy case. See, when you go into a practice, diabetic neuropathy is a challenging one because the nerves are damaged by years together diabetes in a patient, and it becomes a challenge for you to make the correction of the clinical features. So you can go for Shamana Ushadis like Vasanta Kusumakar Rasa, Brahatvata Chintamani Rasa and Chandra Prabhavati for Sukti, Chandra Kala Rasa for Daha. Shiva Gulika is a Shilajatu Rasayana, should never forget from the chapter of Prameha. Shilajatu is a must Rasayana which will improve the circulation of all the parts of the body, whether it is retinopathy, whether it is macroangiopathies, microangiopathy, nephropathy. So all pathy in the body, the Prameha in a Shiva Gulika, Chandra Prabhavati is a choice. Then Shunti Baladikwata is a choice of drug for numbness, Suktata and Balaguluchadi Kwata, Ashwagandha and Shatavari are the Rasayanas, Abraka, Mukta, Pravala, Rajata, Basma can be used for Da. So a brief about Madhu Tailika Basti. Madhu, why it is every Basti, Madhu and Taila are there. Then why this Basti is called specially Madhu Tailika Basti? Madhumcha Tailam Samesyatam, equal quantity of Madhu and Grita, Madhu and Taila. In other Bastis, they are unequal. Madhu is 2 prasrita, then Sneha is 3 prasrita. Here it is equal quantity. So, honey 150 ml, Murcha Tilataila 150 ml, Sainda Valavana, Shatapushpa Kalka, and here the Kashaya is Yerenda Mulakwata added with 1 Madanapala. 1 Madanapala, dry Madanapala should be crushed and added in the preparation of the Kashaya, and this Basti can be administered in Yoga Basti or Kala Basti pattern. It is a Yapana Basti, Brahmana, Yapana. What is Yapana? Ayusho Yapana. It is like Rasayana in the Basti manner. It is a Rasayana Basti. See, about Shamana Sneha, some 3-4 slides are remaining. About Shamana Sneha. Shamana Sneha should never be forgotten in Vata Vyadhi. All treatments, Pitta treatment, Avarana, Kapha, Ama, Kevala Vata, all treatments are over and your patient is alright, but still the treatment is not over. So you have to give the Shamana Sneha to the patient so as to prevent the recurrence of the illness. Say for example, you have treated a Gurdrasi case, you have treated a Vishwachi case, or any the neurological cases you have treated and have got the best result, but still it is not over because Vata is always chanchala. After 1 month, 2 months, patient may again come with the same clinical features which you have given the best result. So to prevent the recurrence of the illness, Sneha Pana, Shamana Sneha must be done after the illness, after the result. That is why Acharya says, Asakritam Punaha Snehaihi Svedeshati Upapadaye Tata Snehamridam Koshte Na Tishtanti Adilamayaha. I always tell to our students, Tasmat Snehamridam Koshte. If the koshta is made mrudu by the Sneha, Na Tishtanti Adilamayaha. In such an individual, the Vata Vyadhi never stays. So if you want to completely remove the Vata Vyadhi from the particular individual, then the last resort after your treatment is a Snehapana. You have to make the Koshta Mrudu, because always Krura Koshta is Vata Vyadhi. You know, right? So if Koshta becomes Krura and patient develops the constipation, a complete evacuation and Sneha makes then Mrudu, then Vata Vyadhi will be clear. So it is not only Koshta Mrudu, so it is beneficial even as Bahya Abhyantarata, Majjagata, Majja is, Mastaka is Majja. So Majja to be treated by Bahya and Abhyantara Sneha, Avapidaka Snehapana. We have given one patient, he is also a patient 21 years old with spinal lumbar injury. So all the treatments we have done and he could able to walk with a stick, but his bladder was not under control. His bladder was, he was telling, you have made me to walk, but how can I walk with a catheter and a urine bag? So I will stay for another 1 month in your hospital, you do some treatment for me. See, then what we have done is, we did Dhanvantara Taila Pichu over the lower abdomen with Marma Gulika Lepa. Marma Gulika, you know, so that should be made into a paste and applied over the lower abdomen for 3 to 4 hours. And overnight we have kept Dhanvantara Taila Pichu over the abdomen and tied when he is sleeping overnight. So we have done it for 15-20 days. And after that he developed some sensation of urination. Then I have asked the sister to clamp the catheter, clamp the tube, so that let us see whether he gets an urge for micturition or not. So then he started getting urge for micturition. Then we have removed the catheter, then he could able to pass the urine. So this Avapedaka Sneha, we have given Bhakyamayantaka Grita. Avapedaka, what is Avapedaka Snehapana? You have studied in Ashtangradaya. What is the line of treatment for Mutra Veda Dharana? Avapedaka Snehapana. Is it not? So Annada, so before food, the Sneha should be given, and then food should be given, then again Sneha should be given. 2 times Sneha should be given in between the, between 2 Snehas, the food should be given. So we have given him 15 ml of Snehapana, after some 3 hours food, and after food, after some 2 hours, again 30 ml Snehapana. And the second day increased to 30 ml first, next 60 ml later. Third day 45 ml first, next 90 ml. Likewise 5 days Bhastyamayantaka Snehapana, the Dhanvantara Taila Pichu and the Marma Gulika Lepa. So he could able to regain the micturition reflex, could able to pass the urine by himself. So Sneha, Dhatun Samsushkan Pushnatyashu Prayojita. All Dhatus get nourished after the Shamana Sneha. You have to follow the protocol of Shamana Sneha and you can choose any of the Taila and Grita for the as I have shown. And Rasayana, you can choose Bhargava Prokta Rasayana, that is Amalaki, Ashwagandha, Balamula. So our teacher, Dr. G.S. Acharya sir, so he is a role model for us in the treatment. So he used to give the Balamula Rasayana and Shatavari Rasayana. See the quantity. So Shatavari can be given as Shamana, Shatavari can be given as Rasayana. So what is the difference between Rasayana and Shamana? The same drug can be Amalaki, can be Shamana, Amalaki can be Rasayana. What makes the difference? Difference is the dosage and the duration. See, if you give, what is the dosage of Lashana Rasayana, which is practiced in the Gridrasi and all. So the Rasayana capsule, the Lashana Rasayana capsule is available, most concentrated. We start with 2-2, morning 2, evening 2 for 2 days. Next we increase 4-4 for 2 days. Next 8-8, then 12-12, 24-24. So in a day he has to take 48 capsule. Morning 24 capsule, evening 24 capsule. Again taper back to 12-12, 8-8, 4-4, 2-2. So in a tapering and increasing and decreasing dosage, and he has to be encouraged to take nearly half to 1 liters of milk with Rasayana. So it will have its own activity. A higher dosage for a shorter period is Rasayana, a lower dosage for a longer period is Shamana. You follow? the same drug, Guduchi, Rasayana. Guduchi can be used as Rasayana also. See, likewise, Shatavari, Balamula, all these can be used as Rasayana. Guggulu, Lashana. So depending upon the condition of the patient, you can choose up and give in a Rasayana pattern. And this is just for your glance. These are the Kashaya, then you have to divide all there is a confusion. Student at internship, they ask, so many Kashayas are there, what to write for whom? It is a confusion. There are so many Guggulus. So you should have a rationality behind the selection of the Kashaya, rationality behind the selection of the Guggulu Kalpas or any medicines. So if anybody asks why you have written Kaishora, why not Amritadi Guggulu, you should be able to answer, then your prescription is solid. If not, our teacher was writing and I am writing is not an answer. See, these are the Grita, Thailas, then Vati, Rasaushadis, which are used in the clinical practice commonly. And take home message, Deepana, Pachana, don't forget, because you are Ayurveda. Deepana, Ayurveda starts with Deepana and Pachana. Agni is the first, then comes Mridu Shodhana for Vata. Don't give any Shodhana. Basti, though is a topmost treatment for Vata, the increased number of Kashaya Basti, Niruha Basti, there is a threat of aggravation of Vata. You followed? So whatever is good in excess is bad. Whatever is good, though Basti is a good, but Basti in excess is bad for Vata. See that your treatment protocol is perfect according to the patient strength, disease strength. You have to select. Then next is a treatment first for Pitta, next for Ama, Kapha, and later at last for Vata. Then Samavata Chikitsa, that is what I have told. Sarvanga, Samsarga Dosha, Avarana Dosha, later comes Kevala Vata Chikitsa. And lastly, the Brahmana, Yat Brahmanam Tat Sarvam Prashastam Vata Roginam. Whatever is Brahmana is the best for Vata. You can make the Brahmana therapy by asking the patient to eat every day Shashtikashali Anna with milk. Brahmana, Sneha to be added with the food. Whatever is Brahmana, Sneha Pana is also a Brahmana therapy. Vata Shamana, Brahmana. And Rasayana as per the requirement. See, these are the physiotherapies, the parallel bar, treadmill, tins, circumduction wheels, traction, hand gym kickboard, hand grip, electrical muscle stimulation, finger grip exercises, cycle, ultrasound and tilt table, so directly we cannot make any patient to stand immediately, so we will keep him on the tilt table and then we will make him to stand. So ekam shastram madiyano na gacche shastra nishtayam yasmat bahushrutam shastram tasmajnaya chikitsa. Parallelly you have to read and study and incorporate the parallel science and then you can give best to the patient. So integrated with physiotherapy, speech and hearing and whatever the modality, suddenly patient, so in acute emergency, the ICU treatment may be necessary. Then when their treatment ends, we can start our treatment. That integration should be there to help the patient's recovery from all. So abhyasat prapyate drishtihi karma siddhi prakashini ratnadi sadasajnanam shastradeva jayate. It is not that I have told, you have heard. Here the learning is not complete. Is it not? Abhyasat prapyate drishtihi. You have to witness. Karma siddhi prakashini. You have to practice. Then only the things come true. Ratnadi Satsajnanam, all Ratna, Uparatna, you cannot say that these are the qualities, so this is this Ratna. So the Jnana comes, na Shastra, just not by, understanding the Shastra, by looking into the things, practicing only, it has to come. So as a student, what you should do? You should not laugh that bench. Huh? At least last side you see, so you will be very happy that you will be later. Yes. So, Shwana Nidra Bhakadhyanam Kakacheshta Tataivacha Alpaharaha Grahatyagi Panchaite Vidyarthi Lakshana. Is it not? What is your Lakshana? Shwana Nidra. Shwana Nidra means as if the dog sleeps. Even with a small sound it will wake up. So, ನಿಮಗೆ ನಾ ಬೆಳಗ್ಗೆ ಅದರಾಮಾಗಿ ಆಫ್ ಮಾಡಿ ಮತ್ತೆ ಕೊನೆಗೆ ಇನ್ನೇನು ಅನಿವಾರ್ಯ ಅನ್ನಾಗಿ ಹೇಳೋದು. That is not Vidyarthi Lakshana. If you are made up your mind to get up and study, you should get up and study. Then Bhakadhyanam. Bhaka stands with one leg for dhyana. So you should always be very energetic to study the science. Kakacheshta Tataivacha. What is Kakacheshta? The crow. So if some food is there, then it will all call all other crows to eat. Likewise, if you learn one thing, you tell all others, your friends, you share. Sharing makes you perfect. ಒಂದ್ಸಲ ನೀವು ಓದಿ ಇನ್ನೊಂದ್ಸಲ ಒಬ್ರಿಗೆ ಹೇಳ್ಬಿಟ್ರೆ ನೀವೇನು ಓದಿದ್ರೆ ಇದು ಮರ್ತು ಹೋಗಲ್ಲ. You follow? ಕಾಕಚೇಷ್ಟ ತಥೈವಚ. ಅಲ್ಪಾಹಾರ. Don't take too much food. If taking too much food, the circulation goes towards the stomach for digestion and brain becomes empty. Is it not? So take little food so that you can be alert for learning. Grahatyagi means you should not have the worries from the home end. So you should be free enough to learn. So Ayurveda, Amritana, among all Amritas, Ayurveda is the best Amrita. So you learn Ayurveda, practice Ayurveda and globalize Ayurveda. If you have any doubts, you can ask. Now the doubt is remaining whether we can go for all such treatments. I should get your patients. Is it not? To practice, you should get patients, no? See, actually, last in 2022, we have conducted one Unnati 2022, a conference, a focus group discussion, calling some 7 neurologists and neurophysicians and neurosurgeons from Mysore in and around, from Apollo Hospital, HOD neurophysician, our JSS Hospital, HOD neurophysician and neurosurgeon from our end, so from other hospitals, and physiotherapy principal, speech and hearing principal, yoga dhyana. So we have done a integrated approach to Ayurveda. I have presented some 10 cases to them, and I have, picturized the Panchakarma therapies which are done and how it works on the Vata Vyadhi patients. So after listening to that, so they are okay that Ayurveda can do like this. So they started sending patients from after the ICU, after post-surgery. Directly patients are referred to our hospital, and under their care. So if something goes wrong, immediately we call them, and whatever possible we do it here. If not, suddenly if something happens, we'll send them back to again the emergency ward, etc. Take hard work to work on this condition, because any time Vata is chanchala, we cannot say like, so na pratignya, you should not promise and treat. You take it as a challenge and treat the patients. So I thank the organizers, Sir Pasuraj Sir and Dr. Veena for giving my opportunity.
Thank you, ma'am, for this insightful session. And it's time to discussion. I request faculty and students, please interact with ma'am with your questionnaires. If anyone are having doubt, please, from students, if you are having any doubts, you can stand and you can ask the questions.
Mic ಕೊಡಿ I should give her.
Namaste ma'am, I am Manasa MR, internee. Ma'am, can we consider stroke as a Urdhvagata Raktapitta?
See, the Samprapti you can consider as Raktapitta, but the presentation is Pakshagata. So you can call not only